GLP drugs might become cheaper.
Oh, now you want to talk medicine.
Yes, I do.
Well, this is leading edge medicine, Dr. Mixon.
Okay.
And I think that's a great step.
It's a great step.
Yes.
And, you know, back when Mr. Trump said he was going to do that 6 months ago, I said, please, 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 because there are drugs I would love for our patients to get. GLP-1 was not first on my list at the time, but it is an important one. The thing that concerns me about it is that GLP-1s are great for reducing obesity. In fact, in the short time they've been on the market, America's obesity has declined by 2%. For the first time in many decades. For the first time in history. You know, we've gotten fatter and fatter and fatter. And for the first time in history, obesity rates are actually dropping in America without starvation being an issue. So the GLP-1s are an important drug. And I guess it's good that the government will cover the cost for Medicaid.
And Medicare.
Well, except that in Medicare, you've got your copay.
Yeah.
Okay. 100% of the cost is for Medicaid, for the welfare patients.
Yes.
And as it turns out, the fattest people in America are the poorest people in America. Yeah. Now, what the correlation, why poverty correlates with obesity in our society is really a question I think needs to be answered. But getting it at no cost to the poorest, fattest portion of America is progress. Now, the older part of America, Medicare, we still have to do their copay. So it won't be, quote, free, but it will be a lot cheaper. Because if the whole price is $125 instead of $1,250, a 90% price reduction, you can pay your copay off a 90% price reduction. You know, the question is, when does that actually start? You know, Mr. Trump said he met with the president of the company, and they've agreed. But they have not yet actually started selling it to the government at that price. So the devil's in the details. We'll see how that works.
Right.
But the rest of us, if you have private insurance, they will only cover it if you meet their criteria for obesity. If you're just overweight, you have to pay the whole price out of pocket, and you don't get the $125 price. You still got the $1,200 or the $600 or whatever they're willing to discount it to these days. So really, for the people that are in their 30s, 40s, and 50s who have weight issues but don't meet the obesity criteria to get the drug, they're kind of that donut hole. And we don't know what the price is going to be for them. Still, progress is progress is progress. You know, we'll take what we can get.
The other thing it highlights, too, is the impact the drugs have had on health. Weight loss, yes, but what does that really mean? It means risk for cancer is coming down, dementia risk is coming down, diabetes is better managed, heart diseases decrease, and therefore there's a huge ripple effect of this for the person, but also for society at large.
You know, and I know we've got some calls waiting, and we'll get to you folks here in just a minute, but one thing you need to realize, 60 countries have longer lifespans than America. And there are only 28 countries in Europe. So most of the countries that have longer lifespans than America have very rudimentary medical care systems. These are second world countries. These are poor countries. And they do not put a lot of time and effort into their medical care. They do not have hospitals and clinics that can do what ours can do. And yet they outlive us by significant margins. And it's because we're fatter than they are. The obesity, the overweight, and I wouldn't say just the obesity. That's why I want to take it all the way back. Every single pound of excess body fat over your ideal weight increases your risk of diabetes, heart attacks, strokes, dementia, kidney failure, cancers. I mean, all the things that kill people, the things we all want to avoid, every single pound of fat on your body increases that risk. Okay. So if you cannot see your abdominal muscles, you are at higher risk for all of those diseases than you should be. So the reason I get that is because the insurance doesn't pick this up until you meet their criteria, and their criteria are way, way, way more fat than you should have. Okay, so what we need to do is to get people to recognize that being overweight is not a social issue. It's not a cosmetic issue. It has nothing to do with your beach body. It's a matter of being crippled and killed early, okay, being disabled and spending your life unable to enjoy yourself the way you should.
Yeah.
And so this is one of my real strong points. If I could wave a magic wand and change anything in America, there would be two things. I would make America lean and fit. Because as every pound of fat is destructive, every pound of muscle helps to repair the damage. So muscle good, fat bad. We need to internalize that as a nation. Okay? And that's not fat shaming, that's biology. Okay? Pure and simple. Okay, let's take a call.
All right, let's get a call, get a question, then we'll go to break. We have Dorothy on the line calling in from Federal Way. Hi there, Dorothy. Welcome.
Hello, Dorothy.
Good morning. Dr. Mixon, I take 1 milligram of melatonin each evening for help in sleeping. Yet yesterday, I believe it was yesterday, they talked about a risk of heart attack for those people that take melatonin.
Yeah,
Did you
I saw
discuss that?
Yeah, I saw that initial report. I think it was Monday or Tuesday of this week, and kind of dived into the literature to find out what's going on.
Yeah,
because it's interesting. We make a lot of melatonin when we're young, and as we age, we make less and less melatonin, and that's one of the reasons that we have sleep disruptions as we age. Is our melatonin levels are low. So it doesn't make intuitive sense that if we restore our melatonin production to youthful levels when we sleep better, that it would increase cardiovascular risk. So we have to take a break. Our engineer is giving me this break symbol. So I'll talk about that when we get back from the break.
All right, we will take a quick break here. Stay right with us, Dorothy. We're going to dive into this a little bit more about melatonin and also about heart disease and heart health, okay? Denz, we're going to talk with you too, and Bob. And if you'd like to get into the call queue, just like our first three callers, here is that number, 1-800-465-8770. We'll be right back.
Leading Edge Medicine. Leading Edge Medicine. For the first time in history, you can choose how to age. Call now with your questions at 1-800-465-8770. That's 1-800-465-8770.
Is chronic pain beginning to make your everyday life a challenge? Then consider the only doctor with over 30 years of experience in pain medicine techniques, including stem cell therapy. That's Dr. Daniel Nelson, MD, with Eastside Pain and Regenerative Medicine. Here's what a satisfied patient had to say.
Yeah, I started about like a year and a half ago. I started having some sharp pain in my left hip. It's getting tough to climb upstairs, tough to play with the kids. Everybody was kind of pointing towards the same thing of, you had to get a hip replacement. And Dr. Nelson's great about saying, hey, there's different types of medicine out there that we can help fix this without surgery. 6 to 8 weeks later, you start to realize like, oh, I can climb a stair. And it was really actually kind of great after that 8-week mark, like, I can start doing things. So definitely see the results pretty quick.
Don't let pain take control of your life. Consider stem cell therapy with Dr. Daniel Nelson, MD. 425-823-4000. That's 425-823-4000. Or you can find Dr. Daniel Nelson online at danielnelsonmd.com.
Oh, it's time to get ready for the holidays and the new year coming up at Bella Medica. We believe that you deserve to look and feel your very best. We're committed to providing you with the safest and most effective treatments available to make you look and feel your very best. Whether you're coming in for a facial, maybe some injectables, or perhaps using some of our laser treatments, Bella Medica has something for everyone. And this month, here are our specials, perfect for the upcoming holidays. Get party ready and schedule your PicoSure or IPL treatment all this month. It's a BOGO. Buy one, get one 50% off. PicoSure or IPL. Make your appointment and get scheduled the month of November at Bella Medica. We're located in Kirkland, and you can contact us by calling 844-744-4844 or bellamedica.com.
L is for the way you look at me. O is for the only one I see. V is very, very extraordinary.
Oh, we're back.
I can't sing
Is
along
even
with him.
more than
His range is different.
anyone that you
Now, Dean
adore
Martin,
can love.
I have almost the same range as Dean Martin, so I sing along with Dean Martin.
But Michael Bublé, really?
No. Michael's a little too high register for me. I can't handle that.
All right. Well, we are back. Leading Edge
impressed that
Medicine.
you know, and
That's
you've
good that you
noticed.
know that. Leading Edge Medicine is here. 1-800-465-8770. We have Dorothy on the line talking about melatonin and heart disease.
But the reason I learned that my range is the same as Dean Martin is because the first song that I learned to sing along with Dean Martin was standing on the corner watching all the girls go by. Wouldn't that be typical? Anyway.
We should have known.
Yes.
No
why did
surprise there.
I even not know this?
Anyway.
Hi, Dorothy. Rescue us.
Yeah, Dr. Mixon's in a mood today. I can't help that. Yeah.
So melatonin and heart disease.
The problem is people who do not sleep well have increased risk of dementia, cardiovascular disease, pulmonary failure, kidney failure, and diabetes. And so why is it that poor sleep results in all of those things? Well, it also raises the question, who uses the most melatonin? People who cannot sleep well. So people who don't use melatonin tend to be people who don't need melatonin. People who use it tend to be people who have sleep disorders, and people who have sleep disorders have increased risk of cardiovascular disease. There's a difference in causation and correlation. Correlation are two things that go together. Causation are something that causes the other thing. And my favorite example of that is the fact that in Florida and California, increased ice cream sales results in increased shark bites. So the more ice cream they sell, the more people get bit by sharks. Now, why would that be? It is a clear correlation. They go together statistically on a regular basis. But you see, when the weather is hot, more people are in the ocean with the sharks. And it's not the sharks get hungrier when ice cream is sold. It's that sharks are more likely to bite you if you're in their water. All right. So teasing out correlation versus causation. Now, when I looked at that paper, what I saw was they said, well, we are looking at other confounding factors. But the confounding factors they looked at were age and weight. So there were a whole series of things. But what they weren't looking at was the degree of sleep disorder. And the worse sleep disorder, the higher the doses of melatonin people tend to take. Okay. Now, personally, you use 1 milligram of melatonin at night. I use 10.
Yes.
Okay. And the reason I use 10 is that at 10 milligrams per night, you double the amount of growth hormone that you produce in the middle of the night in your area of deepest sleep. And so since I want to keep my growth hormone levels as high as possible, because that then helps to rescue my stem cells and lets me grow new brain tissue on a regular basis, okay. I find the 10 milligrams of melatonin to be something that I really think is important for me.
So I have a question about that.
Yes.
Is it 10 milligram for everybody?
10 milligrams was the statistical curve. That's where it reached statistical significance.
Really?
Yes. And so, but there are oncologists, for instance, that put their cancer patients on 60 to 100 milligrams of melatonin a day. Wow. Because melatonin is a very potent anti-cancer drug, too.
Ah,
okay. And so in very high doses, 60 to 100 milligrams a day, it actually slows the growth of a large number of tumors. So Dr. Mixon's first rule of medicine always comes into play. Anything strong enough to help is strong enough to hurt.
Yeah.
You know, there are downsides to every decision we make in medicine. And so deciding to use something or not use it, deciding on what doses you do. The proper dose of any drug is just enough to do the job, but that depends on what job you're trying to do.
Right.
Am I trying to kick up growth hormone levels? Am I trying to reduce my risk of dying of this cancer that I might have?
Yeah.
You know, or am I just trying to sleep better at night?
Right.
And then I have to correlate that with any risk that may have on cardiovascular disease.
Right. I had a conversation with somebody in their 20s and 30s recently, kids, friends were coming and asking about melatonin. Their question to me was, I make some melatonin. If I'm having a few bad nights and I take a little bit extra, it helps. But does that then impact on my own production of melatonin too?
And it does.
And the answer is
yes, it does. Mm-hmm. There is a feedback loop.
Yeah.
But if you're doing it occasionally for a sleep disorder once or twice a week or 3 or 4 times a month, it's not going to have a long-term impact.
Yeah.
Because the feedback loop goes away.
Yeah.
You know,
right.
Short. Now, depending on what else you were taking. Okay, I'm getting a signal saying we have 4 calls waiting. Move it along. So I shall. Did that answer your question?
Was that helpful, Dorothy?
I think it's helpful. I think bottom line is use as little as you need, and yes. It's probably not an issue. But when they said there's a correlation, as you say, it makes one think about, maybe I better cut back. But thank you very much. I appreciate the input.
Thank you, Dorothy.
Bye-bye.
Yeah.
All right, we are going to put some sunscreen on. We're heading south to Florida. We have Denz on the line. Hi,
Hello,
Denz.
How are you today, sir?
Great. Good morning. Can you hear me fine? Okay.
We hear you just fine.
I have a question. Well, first of all, thank you for all your work. It's very much appreciated. I have a question regarding hydrogen bottles that you can take. Can you speak on that as far as do you think
the hydrogenated water?
Any health benefits?
Is it the hydrogenated water you're talking about?
Well, the bottles you get, and then you can turn it on, and it infuses a little bit of hydrogen molecules, I guess, particles rather, and then you drink it.
Ions is whether, hydrogen ions. All right. Hydrogen is the most common molecule in the universe. So
let's start with that.
Yeah, we start with basics, and it is water. Basically, is 1 oxygen and 2 hydrogen molecules, and they've got these little devices that basically put a modest electrical charge and a tiny amount of salts into the water, and it basically ionizes, that is, kicks out a few extra hydrogen molecules. I am not aware that it does anything other than make the people that sell them really, really rich. All right. anytime you've got salt, any degree of salt or minerals in your water, you're going to get some ionization. Any amount of electrical charge in that will also ionize a little bit. But you're basically, you're getting hydrogen in every breath. You're getting hydrogen in everything you eat and everything you drink. I am not aware of a single peer-reviewed paper that has provided any compelling evidence that drinking hydrogenated water is beneficial to anybody except the people selling it.
Okay.
Does that answer your? That's my opinion. Now you got to remember that when you get my opinion, you're getting my opinion. You're not getting truth with a capital T. Great God Almighty has not imbued me with all knowledge.
Not yet.
Okay. Well, I just wanted to get your opinion. I appreciate it.
All right. You take care, sir. Bye-bye.
Thank you so much for the call, Dens. We have a couple more callers on the line on different topics. This is Leading Edge Medicine, 1-800-465-8770. That's 1-800-465-8770. We have about a minute and a half before we hit break. Dr. Mixon, you were on TV again this past week.
Yes, I was.
On Northwest, New Day Northwest.
Isn't that fun?
Yeah.
Yes. 6 whole minutes.
There you go. And you gave us everything you know about andropause, which is the male menopause. Is that right?
No.
No?
No. I did not give you everything I know about it. I give you 6 minutes.
Okay.
I give you a little tiny taste.
Just a bit.
Just a little taste. And if you really want to know about andropause, you need to come and be a patient at Longevity Medical Clinic. And then we will dive into your andropause in great depth and make it go away. So,
but the bottom line is that it affects brain, heart, bone.
It affects the same thing in men that it affects in women. The fact is that we are bundles of hormones, and I love your analogy of the hormone symphony, all playing their part, each doing a different role and a different tune and a different octave. And as long as nothing's out of tune, things go well. But when the bassoons drop out, all of a sudden, the 1812 overture is not quite as well-rounded as it should be. Right? And so, and as we age, instrument after instrument start going awry. And of the 8 primary hormones, of the 10 hormones we actually look at, and the 8 that we measure and adjust on a regular basis, they go awry in men just like they do in women. And so the more we can tune them up, the more we can put them back to where they were when you functioned at your best, the better you will function. And the further out we let them go, the worse off you're going to be. And that's true if you're a man or a woman. So
there you go. Are you going to talk more about that when you're back on the show November 20th? Or will you pick a different topic? What do you think? You got a couple weeks.
I got a couple weeks.
We'll let you. Okay, we'll talk more about that in just a bit. We are going to be back with more of your calls right here on Leading Edge Medicine, 1-800-465-8770. Stay right there or give us a call. We'll be back.
Leading Edge Medicine. Leading Edge Medicine. Join in the conversation at 1-800-465-8770 and tell your friends to listen. That's 1-800-465-8770.
Have you stopped to think about how you feel today compared to, say, 10 years ago? Are you noticing changes? Less energy, slow recovery, trouble focusing, maybe even weight gain? What if you could turn back the clock and feel stronger, sharper, and more alive? At Longevity Medical Clinic, we help people do exactly that. For over 3 decades, we've been helping thousands of men and women find out what's really going on inside their bodies and take action to feel better and live longer. With advanced diagnostics and personalized hormone and supplement plans, we uncover what's been holding you back and show you how to optimize your health. Our patients often say, "Now I finally finally understand what's happening and what to do about it. Take the first step today. Call 866-86-YOUNG or visit lmclinic.com to schedule your free consultation. Longevity Medical Clinic. Feel better. Live longer. Let's do it together.
Have you been struggling to shed extra pounds? Having a partner on your weight loss journey can make all the difference. That's why at Longevity Medical Clinic, we're excited to launch our weight management program, working hand in hand with you to achieve your weight and health goals. What makes our program different? It's a medical weight management program that uses advanced science to develop your customized prescription, nutrition, and fitness plan. You're under doctor supervision every step of the way. It's our goal to help you look and feel your best now and for years to come. One important thing to know is that our new weight management program will be open to everyone, not just our longevity patients. Call us at 866-869-6864 to schedule your consultation today. That's 866-869-6864.
Are you happy with how you're feeling these days? Are you slowing down physically or mentally? Ever wonder what your life will be like 10 to 15 years from now? Most of us don't really know how we're aging or if we can even do anything about it. But here's the truth. Knowledge is power, and that's exactly where we start at Longevity Medical Clinic. We run advanced diagnostics to find out what's really going on inside your body, and then we create a personalized hormone and health optimization plan designed specifically to help you live better starting now. Our patients are often amazed by what they discover in their blood work, and even more amazed at how quickly they start to feel like themselves again. This isn't guesswork, it's science, it's personal, and it works. Take the first step today. Call 866-86-YOUNG or visit lmclinic.com to schedule your free consultation. Longevity Medical Clinic. Feel better today and every day after that.
Back with Leading Edge Medicine. So glad you're here. My name is Lynette here with Dr. Samira Umat and Dr. Ken Pentland. You can wave because we're streaming on video today. KTTH Seattle and Dr. Jerry Mixon.
That's right.
And we're taking your calls, 1-800-465-8770. We are headed now to Lake Stevens. We have Bob on the line. Hi, Bob.
Hello, Bob.
Good morning.
Good morning, sir.
I am calling regarding testosterone. You about 2 or 3 weeks ago in discussion with another person was discussing testosterone-free levels. And I wanted to confirm, because I didn't catch the whole conversation. I just heard that part. I wanted to confirm that I believe you had said that you try to keep your levels of the free between 150 and 180. Does that sound correct?
That's what we do for the clinic writ large, yes, 150 to 180. And, you know, depending on what they're trying to do, for instance, you remember my second rule, or the proper dose of a drug is enough to do the job, but that depends on what job you're trying to do, you know. If I've got somebody that has a significant weight issue and they're really working, trying to get their weight down, I'll carry them higher for a while, you know, not forever, but for, 3-6 months or whatever I need to. Because when you get that level up closer to 200, 210, you are still within the normal range. You're just in the higher end of the normal range. And you do a better job of shifting their metabolism towards muscle, away from fat. And muscle burns 5 times more calories in any given day than fat does. And so, muscle good, fat bad. And if you're trying to lose fat, we may carry you higher for a while. We are not taking you up to the bodybuilder levels of over 1,000, on the other hand. So you get the feeling.
Well, I'm a 72-year-old man in reasonably good health and reasonably good shape. Not perfect, but I'm not what I would call obese. And I can almost see my abdominal muscles. I work on that. It's a struggle sometimes, but sure. I feel good about my physical condition. testosterone bioavailable I worked with a naturopath in my local area, and we've been trying to adjust and get my testosterone levels. I've been seeing her for about 2 years, and about every 90 days we come in and do blood tests, and we've been working on adjusted. And I think we're getting close. My last free was at 168.
Nice
my
place.
bioavailable was at 376, and my total was at 1185. But I also heard that you said that you could live with, as a doctor, depending on circumstances, if the free and the bioavailable were within range, that the total could be a little out of whack.
Yes. Yeah, I'm less concerned about the total. Testosterone, the total testosterone is all the forms that are in your bloodstream. And then the free is that is not bound to any protein. It's actually free molecules able to get into the cells and do their job. The bioavailable is bound by albumin instead of sex hormone binding globulin. Sex hormone binding globulin is tightly bound, so the portion tied up by that is not going to be used. It's just whizzing around. The albumin bound, your body can pull it off when it needs it. So if you're putting physiologic stress on your body and the cells need more testosterone, they can pull some off the albumin. So it is bioavailable but not free. Does that explain it, I hope?
Okay. So the 376 level of that, and just, you don't know me or anything, but does that sound like it's in a reasonable range for my age?
That is in a reasonable range, yes, sure.
Okay. The reason I'm asking is the lab, Quest Diagnostics, who does her labs, supposedly adjusts for age, and I think that's where they're showing me a maximum on the free of the range between 6 and 73, and for the bioavailable 15 to 150. And obviously my numbers are significantly different than that, but I wanted to sort of confirm because I trust you. I've been listening to you for years, and I just wanted to bounce it off of you.
Okay, well, here's the difference, and this is something people really don't understand. Normal is great when you're 18 years old. By the time you're 70, normal really stinks. Normal is what usually happens, right? So that 18-year-old is going to run a total testosterone of 1,000 to 1,500, and he's going to run a free of about 170 up to about 210. That's where that 18-year-old athlete usually runs. Okay. Now, as you age, your testicles are being invaded by senescent cells. And the senescent cells are preventing your gonads from doing their job. And so your production goes down and down and down. And by the time you're 70 years old, normal is really bad. Normal means you're weak, you're tired, you shift your metabolism towards fat, your risk of heart attacks and strokes, are sky high. All those things that testosterone helps protect you against, you're getting virtually no protection. But it's normal because that's what usually happens with aging. Okay? So people make the mistake of thinking normal equals good. No. Normal means you're falling apart just as fast as the average person your age. And if your goal is to fall apart on schedule, you go for normal. If you want to be the best you can be, you go for optimal, which is very different from normal.
I have convinced my wife to begin seeing my naturopath for testosterone therapy, for hormone therapy, which of course will include testosterone. But while I was on the subject of testosterone levels, she is also 72 in reasonably good shape. What would be, quote, a good, not using the word normal, a good level for her in the free bio, those two items?
Okay, bioavailable. Yeah. Okay, with women, we do not want her to be masculinized like you, okay? We want you lean and hard and angular. We want her to be soft and rounded, but not chubby. There's a difference, Okay? The illustration I use for women is, I don't want women to look like Twiggy, if you remember that image.
That one,
the anorectic little model, with skinny arms and legs. That's not what a woman should look like, but neither should she be round and Rubenesque, okay? She should be lean and strong like a jungle cat. You envision a panther or a leopard crouched on the branch, ready to leap upon its prey. That's what a woman should look like, okay? Lean and strong and fit. So she should have enough estrogen to keep the subcutaneous fat layer there, but not enough estrogen beta receptor activity to give her a round belly. There's a difference. And so we need to raise her testosterone and her estradiol and her progesterone together. And so it's a matter of levels, but it's also a matter of ratios. That's that symphony that Dr. Umad is so prone to discuss. Okay, you need everything in tune. Because if you give her out of balance with too much testosterone, she's going to get what's called an androgen vaginitis. Her vagina is not designed to do well with a lot of testosterone. And yet, as a young woman, she had 2 to 3 times more testosterone in her blood than estrogen. So she actually needs more testosterone than estrogen to be really healthy and fit, okay? But you have to get the balance and the ratios right. And that's why you need to work with doctors who do this on a regular basis and know what the hell they're doing.
Yeah, that's the one I've been working with. This is my naturopath for about 2.5 years, and I'm very pleased with her approach. What you have espoused, that I don't listen to you every weekend, but I listen to you a lot. I feel that she is working that with me.
Good. Good. Now, is she also addressing pregnenolone, dehydroepiandrosterone, looking at her IGF-1, these sorts of things too?
Yes.
Good.
And with me, she I don't remember how many hormones she tracks, but I think she tracks them all because there's quite a few.
Good. Okay. Well, and that's what should be done. So it sounds like you got somebody that I may want to hire.
There we go.
Because I would love to have some Florida clinics, but finding people that do it right is tough. So.
Well, I'm in Lake Stevens. Previous guy was Florida.
Yeah, Bob is Lake.
Oh.
Denz was Florida.
Oh, Denz was Florida.
Yeah, so okay. Lake Stevens. Yeah, we could still.
We still may be able
to make a call.
Mm-hmm.
Pardon me if I don't let her know about you.
Yeah.
All right, my friend.
Oh, Bob,
take care.
You so
Have a
much.
Wonderful day.
Yes, great call there.
Hello?
Yes, you're here.
The potential levels for her free and bioavailable.
Where do you like to carry your ladies?
For women, for testosterone between 4 and 8, but it depends on other things like you said, and if they have autoimmune diseases, a little bit higher because they do better with that. Estradiol between 40 to 100, and progesterone from 2 to 8.
I'm sorry, the free was 4 to 8?
Yes.
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 And the bioavailable?
Oh, I don't.
We don't usually track the bioavailable.
Yeah.
We're looking at the free because that's our best indicator.
Yeah.
All right. Thank you.
Thank you for the call, Bob.
Bye-bye.
We are taking a break. We'll be back with Sheila, and we're going to talk about gastro something. Something in the I think that's Dr. Pentland's expertise. Here's the number to get into the call queue. Room for you at 1-800-465-8770. We'll be right back.
Aging gracefully is a terrible option. Learn to live to your fullest potential. It's a lot more fun. Call now with your questions at 1-800-465-8770. That's 1-800-465-8770. And stay tuned for more of the show. At Longevity Medical Clinic, we're always looking for ways to better support your health journey. That's why we're excited to share that Longevity Development, our business and marketing arm, has entered a new management relationship with Paramount Pharmacy. We can't tell you where to fill your compounded prescriptions. That's entirely your choice. But for years, we've confidently recommended Paramount Pharmacy because of their excellent quality control, competitive pricing, and outstanding customer service. And now with this closer collaboration, we're working side by side to make your healthcare experience even better. To celebrate, Paramount Pharmacy is offering a 30% discount on your first 90-day supply of compounded medication for all new patients. Interested? Just call Paramount at 425-251-1660. That's 425-251-1660. Paramount Pharmacy and Longevity Medical Clinic, a team approach to better healthcare.
Are you ready to get rid of your reading glasses? Or maybe as you're getting older, and we all are, you just want your vision to be the best it can be. It's time to look into refractive lens exchange at Northwest Vision Institute with Dr. Michael Gilbert. RLE is performed in the same process as cataract surgery. The natural lens is removed and replaced with a high-tech intraocular lens implant. Basically, what that means is your vision will be crystal clear, you'll be able to see far away or up close or both. The difference is incredible. Imagine. No more contact lenses. No more searching for the reading glasses. Most likely, these will be the last lenses you will ever need. RLE is just one of the services offered at Northwest Vision Institute. Come in and see Dr. Michael Gilbert and his team at Northwest Vision Institute. Call 425-450-2020 or online nwvision.com.
Called the doctor, woke him up and said, "Doctor, ain't there nothing I can take?" I said, "Doctor, to relieve this bellyache." I said, "Doctor, ain't there nothing I can take?" I said, "Doctor, to relieve this bellyache." Now let me get this straight. Put the lime in the coconut.
Put the lime in the coconut.
Y'all know that part.
Put the lime in the coconut.
We are back. It's Leading Edge Medicine, and you might suggest a lime in the coconut if they're needing to reduce stress and take a vacation.
Only if they're in Jamaica.
Jamaica.
It works best if you're in a hammock, strung between two pine trees, looking over turquoise water and sugar white sand, and being rocked by the beautiful spouse of your choice.
There you go. I don't know. I might have Bandine rock me in that because, yeah. Oh, let's take a phone call.
I don't think she will ever do that.
No. Yeah, but she's so strong. She could.
She could.
1-800-465-8770. That's 1-800-465-8770 to get through with your calls about your aging health. We are headed to north of Seattle. We have Sheila on the line. Is that right, Sheila? Where are you calling from?
Hello, Sheila.
I'm calling from Linwood.
Linwood. Okay. Oh, Linwood. Perfect. How can we help, Sheila?
Well, it started out, I was going to ask you about this gastric disturbance business, but you got on to melatonin. And I will tell you, I never took it in my life until they gave it to me in the hospital, and I turned into a paranoid person, ready to kill anybody that came near me.
Oh, my.
Oh, my goodness. Well, I'm keeping you away from melatonin.
Yes.
And they've taken other things, like I could take a certain steroid. They gave me a different one. I lost 2 full days in the hospital, and I was ready to kill anybody that came near me because they were going to hurt me.
So you have interesting idiosyncratic reactions.
Yeah.
So,
Drug combinations too.
Wow.
Normally, I can take something one time, such as a vaccination or a medication, and get by with it, but don't take it a second time.
Okay.
Because something very bad is going to happen.
Oh, we don't want that.
We clearly don't want that.
No.
But what can we help you with today? I mean, clearly there's not much I can do about your...
this gastric thing. I've been given 2 different medications. Nothing stops the pain. I went to the hospital and they put me to sleep and they looked into my stomach and they said there wasn't anything too disturbing except there was blood in my stomach. I haven't got the report back yet, but can blood in your stomach be anything but a bad sign?
Well, yeah, you're not supposed to be bleeding into your stomach. The question is why?
Yeah.
Is this a gastritis where the stomach is just inflamed and irritated and kind of oozing blood? Or is there a tumor sitting there somewhere that's eroded through a vessel and is bleeding?
Worked right for quite a while. I'm very, very old. And often I'm eating something and it stops, sticks in my throat, won't go down, have to throw everything up. And that's because the esophagus is stretched because I'm so damn old.
All right.
Do you have heartburn or reflux symptoms?
I don't have heartburn. I have pain in the stomach. I get up in the morning, it's okay. Whatever I eat is not okay. As soon as I finish eating it, I have a bellyache till the next time I have to eat. And at night, I wake up with acid in my mouth on the hour, every hour that I'm asleep.
Okay. What is your sleep position?
I sleep on my side.
Okay. And it sounds like you would probably be better to get a bed where the head of the bed can be elevated so that you have gravity to help pull things down.
I did that. I bought one of those things that raises you up, and all it did was make my neck bad.
Oh, dear.
And I still had the same incidences every hour. So I said, to heck with that.
Yeah.
It's just making me more miserable than I am.
Okay. So you've consulted a gastroenterologist. They have done your endoscopy, but we don't yet have a report. All we have is you're telling us that there is blood in your stomach for some reason.
I haven't got the report yet. It takes a vast amount of time to get anything medical.
Yep, it
you
often
wait
does.
and you wait and you wait.
Okay. Well, it sounds to me like this is not an issue we can solve on the radio.
Yeah.
You need to have the gastroenterologist sorting through this and getting that report.
She told
Hopefully
me
the
when
doctor
I get
has
the report to go to my primary doctor, which fortunately I've been waiting 2 months to see, but it's almost here. So I'll take the report to him, I guess. That's what she meant. And
well, either the gastroenterologist who did the study or the primary care doc. I mean, hopefully the two of them have talked, and the gastroenterologist has told the primary care doctor what he would like him to do for you.
Well, that would be nice.
Yeah, we are not
Anyhow,
privy
I
to
just
that
wanted to
information,
tell you
obviously.
what melatonin can do to you, or to somebody like me.
Yes, yeah, but because
And so,
the problem is
anytime-
we call these idiosyncratic reactions because people who react differently than most people. For instance, there are people who, hell, I was raised on peanut butter and jelly sandwiches. But there are people that if they ate my peanut butter sandwich, they'd die. That's and so there is nothing that is totally innocuous in this world. And for you, it sounds like you have a fair number of things you don't tolerate.
But what would cause this thing of being able to take a vaccination once but not twice without pretty severe reaction?
Yeah, well, again, you may have something really, hypersensitivity reaction in your immune system. And once more, that would be an immunologist, because this is a very, very specialized field of study, So, if I were you, I would be consulting an immunologist about it. That is what they do. They look at they only work with the immune system.
I wonder if it's worth it. I'm so old, I shouldn't even be here.
Well,
but I am.
And you are. And, if you plan to hang around for a while, I'd want to know why I was having these issues. So
yeah, I think so. Okay. Well, thank you for your input.
You're welcome, ma'am. Take care.
It's about like everybody else's.
Yep. I don't have all the answers, as I've said before. The good Lord has not given me truth with a capital T.
I'm even allergic to an allergy pill, Claritin.
All right.
I was taking that because I have allergies. I was allergic to it.
Allergic to the allergy medicine, yeah. Once more, you have an immune system that does not function like most of us. You need to be under the care of a doctor who specializes in this.
You're special, Sheila.
That's right. All my questions.
All right.
Wonderful.
I have an
Thank you very much.
It's like most people's.
There you
go. So whatever is.
Okay. Bye-bye, Sheila.
Thank you so much for the call, Sheila. We are headed into hour number 2 on Leading Edge Medicine, and we would love to have you call the show if you've got a question about your aging health, things that you're dealing with, maybe a diagnosis that your doctor has explained to you, and you'd like to ask the doctors. We have 3 in the studio, Dr. Samira Umat, we have Dr. Ken Pentland, and Dr. Jerry Mixon. Here's that number to get through with your questions today, 1-800-465-8770. All right, doctors, let's take a moment and talk about longevity and why we want you here as a patient. And here's something, a reminder for you that you can use your health savings account, HSA, for your longevity medical clinic program, a smart way to invest in your health while using those pre-tax dollars. And don't forget, most of those HSAs need to be used before the end of the year. So find out about that and schedule your visit. And Dr. Pentland, maybe you could explain what a visit the first time to a longevity clinic would look like.
Well, I usually tell patients what Dr. Mixon says, normal stinks.
Yeah.
That's usually the first thing I say after I get an idea of why they came in. We want to understand their goals and what brings them to do more about their health, right? And then I go into, what a conventional medical visit would look like compared to what we do. And I go into the idea that normal stinks. What generally happens is when you get your blood test back and they say, congratulations, it's all normal. And you're like, I still don't feel well. What does normal mean? It's like usually you're getting a prescription drug for those people who are sick, and everyone else come back later when you're sicker and we'll give you a drug.
But for us, it's a matter of trying to figure out why you don't feel as well as you should.
Yeah.
And so we don't use normal values. We use optimal values. And the goal is to make you be as strong and fast and lean and smart and sexy and happy as you can possibly be at any point in your life. So Longevity Medical Clinic is to make you the best you can be, not just normal.
Absolutely. Make your appointment today. You can come and join us in Linwood, in Kirkland, and our clinic in Tacoma as well. Here's that number to make your appointment for your health analysis. It's 866-86-YOUNG. That's 866-86-YOUNG. Taking a quick break here, and we will be back with the doctors and more of your questions on Leading Edge Medicine in just a moment. Stay right there.
Seattle Red on 770 KTTH Seattle, 97.3 KIRO FM, HD3 Tacoma Seattle, 94.5 K233 DT Eastlake, 33 BU Seattle.
The following is a paid program on this station.
Welcome back to this second hour of Leading Edge Medicine. Leading Edge Medicine provides only general medical information. Since everyone's individual situation is unique, you should consult your own physician before taking any action related to your personal health. All content of this program is intended for general informational purposes only. Good morning and welcome to Leading Edge Medicine with Dr. Jerry Mixon and Dr. Samira Umat. Leading Edge Medicine is sponsored by Longevity Medical Clinics and is devoted to helping you feel and function better tomorrow than you do today by providing the newest and most advanced medical care designed to improve both your body and your brain. Leading Edge Medicine will keep you informed regarding the very latest developments in science and medicine while highlighting some of the Northwest's most prominent physicians, all while helping you separate the science from the silly and the facts from the fiction. This is live call-in radio at its very best, giving you the opportunity to participate in the show. Now, here are your hosts for Leading Edge Medicine, Dr. Jerry Mixon and Dr. Samira Umat, along with their co-host, Lynette Morgan.
And welcome back. It's Leading Edge Medicine. I'm Lynette with you, along with wonderful doctors. We have Dr. Ken Pentland in the studio, Dr. Samira Umat, and Dr. Jerry Mixon. So let's talk about, well, one of your specialties, Dr. Pentland. I'm going to give you the microphone.
We're going to talk about,
yeah.
I don't know if it's my specialty, but
yeah, you're right.
Well, you deal with it a lot.
A lot about men's health issue. He has a lot of special interests like we all do. But
well, so one of the things that we see happen with men is they don't come in when something's bothering them.
True.
This is a thing that's common. And so I wanted to talk a little bit about lower urinary tract symptoms, which is termed LUTs, right? What does that entail? So urinary frequency, urgency, incomplete elimination from the bladder, straining, intermittency, weak stream. These kinds of things are symptoms that are called lower urinary tract symptoms. And it affects 60 to 70% of men over 50, yet only about 30% are coming in to deal with it. And that leaves about 3 to 4 years of time on average where they're not dealing with something that should be addressed. So I wanted to go through a list here, like what's going to happen if you're not addressing it. Top 5 reasons why to act sooner. Okay. Number 5, better sleep. Right. If your sleep's interrupted, you're going to have more brain fog, poor focus, increased tendency to anxiety and depression. Even if you go back to sleep, fairly well, wake up rested, these things are still more of an issue than if you're not.
Weight gain.
Weight gain, right. Natural killer cells are more active with undisturbed sleep, and that reduces cancer risk, right? Lots of things for better sleep. Number 4, reduce erectile dysfunction. The persistent pressure on the prostate reduces libido and erectile strength over time. Scary thing, right? Number 3, better pelvic and heart health. So when you have frequent straining, regular straining to urinate, it irritates the pelvic nerves, increases risk for incontinence, pelvic floor dysfunction. But also in the Framingham study, they showed that the frequent straining at night causes these blood pressure spikes that increase cardiovascular events, increases risk for heart attack and stroke. So let's keep that to a minimum. Number 2, better bladder health. So when you have incomplete emptying, urine remains in the bladder, and that's a breeding ground for bacteria and crystals. If you ask most people, would you like a bladder stone? They're going to say, hard pass. No. And it is a hard pass. You can't really pass a bladder stone.
Owie.
That's usually surgery. And so we want to reduce that as much as possible, right? And then number 1, reduce kidney damage. Nobody wants kidney damage. So this repeated back pressure of urine that's hitting the kidney, impacting the kidneys, causing urine stagnation in the kidneys, increasing kidney stones, gradually decreasing filtration rate, raising creatinine levels. Over time, you see kidney degradation and function. So eventually down the road, that leads to dialysis. So we don't want to do that. But things you can do to prevent that, there's a lot to do. I mean, drinking plenty of water, maintaining a regular exercise regimen. One of the things we do at Longevity is the ViaSure process. It's a sound wave procedure, outpatient, non-invasive, and safe. And we've seen good results with that. So, for example, incomplete emptying, patients are reporting 62% improvement in that. So that means bacteria and crystals, right? For a week, for straining, we see 69% improvement in straining with that. So less risk of heart attack and stroke in the middle of the night. Right? So if you're interested in doing a ViaSure consult, get on the schedule, give us a call, Linwood, Tacoma, or Kirkland.
Very good. Thank you,
Sounds
Dr.
good.
Pentland. And if you have any questions about that today, then you can contact us right now. Our phone lines are open, 1-800-465-8770 with your questions. And look, we've got Judith on the line calling in quick. Hi there, Judith, calling in from Buckley. How can we help?
Hi.
Hello, Judith.
Okay, so I'm a 69-year-old woman. Had a gastric bypass 21 years ago. And I recently was diagnosed with adult onset ADHD, even though I know I've pretty much had it all my life. But the issue is with medications and a Rowan-U bypass, there's an absorption question that always seems to come up. And right now they had me on Adderall and 5 milligrams to start. And am I not getting the full 5 milligrams? This was not this was an instant release, not a extended release. And when I ingest it, because I've had this problem the entire time, am I really getting the amount that I'm taking? Because it goes through the digestive system and so on. So I was just wondering if you guys could give me a little bit clearer insight to that.
It has to do with the surface area of the small intestine, doesn't it?
Well, it does, but these are water soluble. It's not a fat soluble compound. So any wet surface and mucous membrane should be absorbing. So she should actually start absorbing it in the stomach and then right into the duodenum. So I would not think there would be a real question. If you have a question about it, it is one of those drugs they can actually measure your blood levels.
Okay.
Yeah, the doctor who is prescribing it, if you're not getting the results that they expect, then he can draw blood 30 minutes to an hour after you take the pill, and you should be getting close to your peak values then.
That's good information.
Yeah, and they can actually measure how much of it is in your bloodstream, and that way if they need to raise the dose because you're not absorbing it well for some reason, they can.
Okay, so I don't have a stomach. I mean, it goes straight into my whatever they did to bypass, whatever. Yeah. So the question has always been, when I take my vitamins, when I take Tylenol, when I take, any pain meds, am I getting the full amount? Unless it goes in through an IV or under the tongue or some other way. Mm-hmm. So you're saying they can test
sure they can.
After I take it. Okay. All right. Well, that helps.
And then similarly, also for your nutrients, there are tests that we can do to measure your levels. We do a specialist test called micronutrient analysis, which gives us an idea of cellular level of a lot of different vitamins and minerals.
We actually measure 35 different vitamins and minerals in your bloodstream. So we get a very good picture of, how adequate your intake is and your absorption.
Yeah.
But for the Adderall is a common drug of abuse. And so as a consequence of that, they have long since developed very sensitive testing to see how much is in your bloodstream, because they get it with overdose deaths and so on all the time.
Oh, okay. Yeah, I just want to make sure that, I know that they were going to try the Ritalin patch. But of course, my insurance said that they had to have more evidence of the changeover.
Yes.
And
frustrating.
Then they put me. Yeah, it is. And we've kind of looked at this over the years and overlooked it. But now, that I'm older and almost 70 trips around the sun here in a couple of months. I'm concerned because the brain fog and the forgetfulness and the memory issues and all that kind of stuff. Is it part of my ADHD, or is it just I'm getting older? So I think
is it age-related cognitive decline. Yeah.
Mm-hmm.
And that is very real. Everyone's brain function changes with age.
Mm-hmm.
And so age-related cognitive decline is well established. And if someone that already has an issue such as ADHD, and you throw that on top of the normal decline of cognition with aging, you can get in real trouble. So there are some things you can try. For instance, one of the supplements that one of my companies makes, called Think Factor, has actually been used with ADHD people. The studies were in teenage boys mostly, not in ladies of your age. But in teenage boys, it did indeed improve cognition and focus. So,
is that kind of the same as that focus factor I hear advertised all the time?
No, it's not.
Okay, because I didn't see very good reviews on that.
Yeah, this is one that I actually designed myself. It's got 3 things in it. It's basically raises the neurotransmitter levels in your brain. And so the first components kick in within the first month or 6 weeks, and then within about 6 months, some other far more complex things come into play. The longer you take it, the better it tends to work. So it's something that you can give a try. Obviously, your stomach issue always complicates things, makes it makes things less predictable. So. But in teenagers with ADHD, actually in medical students, it made their brains work faster and more efficiently too. So, and it's been tried as people as old as their mid-80s in the nursing homes, and again, they also got improvement. So, wide range for adults, anywhere from late adolescence until nursing home stays.
And then in your case, you should probably think about transdermal estrogen and progesterone as well.
Yes.
Because that can be very helpful for balancing your hormones, helping with your brain, as well as with your bones and heart health.
Yeah, bone health, I would think, is
an
issue with
thank you for saying that, because I've often wondered. I had a hysterectomy when I was 40, and I took whatever that
Premarin?
With that one. See what I mean about my memory? Yes, for a few years, and then I just changed over to some black cohash and wild gem and went that direction. But I've often wondered, over the years, am I supposed to have a supplement? Should I? And I've asked a couple of my doctors, and they just kind of blow it off and don't really give me, any answers in that. But so you think that might be something I should check into?
Oh, yes. Yeah, you definitely should.
Okay.
At your age, moving your hormone levels back to a more robust level, it will almost always be of great benefit.
Is there specific testing? I'm sure there must be for that to see where I'm at, like a baseline. Okay.
Well, yeah, but
I hear
that's
the
what we
music
do.
playing, so
stay
I'll
right
let
there,
you go.
Judith. And we're going to tell you more. Don't hang up. And Ed, we'll get to your call in just a few moments. Here's the phone number to get through today and be live on the air with us. 1-800-465-8770. Taking a break. We'll be back with more Leading Edge Medicine.
Leading Edge Medicine. Leading Edge Medicine. Listen to past programs by going to lmclinic.com. Call in now at 1-800-465-8770. That's 1-800-465-8770.
What if weight loss didn't feel like a lonely battle? What if you had a proven tool and a trusted guide by your side? At Longevity Medical Clinics, our medically supervised GLP-1 weight loss program helps you shed pounds, boost your metabolism, and feel more like yourself again. But unlike online programs that drop medication at your doorstep and disappear, we take the time to understand your body. We track your lab work, monitor your safety, and adjust your plan so that your results are healthy and lasting. Because weight loss isn't one size fits all, and you deserve a program designed for your unique biology. If you're serious about losing weight and you want to do it the right way, Longevity Medical Clinic is here to help. Call Longevity Medical Clinics today at 866-86-YOUNG or visit lmclinic.com for your free health analysis. Longevity Medical Clinics, real medicine, real monitoring, real results. Call 866-86-YOUNG or visit lmclinic.com.
Oh, it's time to get ready for the holidays and the new year coming up at Bella Medica. We believe that you deserve to look and feel your very best. We're committed to providing you with the safest and most effective treatments available to make you look and feel your very best. Whether you're coming in for a facial, maybe some injectables, or perhaps using some of our laser treatments, Bella Medica has something for everyone. And this month, here are our specials, perfect for the upcoming holidays. Get party ready and schedule your PicoSure or IPL treatment all this month. It's a BOGO. Buy one, get one 50% off. PicoSure or IPL. Make your appointment and get scheduled the month of November at Bella Medica. We're located in Kirkland, and you can contact us by calling 844-744-4844 or bellamedica.com.
Saturday night and the moon is out. I want to head on over to the Twist and Shout. Find a two-step partner and a Cajun beat. When it lifts me up, I'm going to find my feet. Out in the middle of a big dance floor, and I hear that fiddle, want to beg for more. Want to dance to a band from Louisiana tonight.
Oh, yeah.
We don't get much Cajun stomping music going on here.
No, we don't.
I like it too.
Oh, we are back with more leading edge medicine in your phone calls at 1-800-465-8770. And Judith asked the question that we love to hear. How do you measure for that?
Okay.
Yeah.
Well, two things. I'm going to answer Judith in just one moment. For those of you that are streaming this live and watching, you keep seeing Dr. Mixon looking at his phone. I'm not trying to ignore you, but my daughter is in a fencing match today. She just won her first match, 5-1. So, proud daddy again. But she's going to be fencing all morning. So my wife is going to keep buzzing me and sending me videos, and I'm going to keep getting distracted. Two most important people in my world are my wife and my youngest daughter. So sorry, guys, if I ignore you, that's why. It's just the way it works.
It's not for long.
Banding and Ivory get my attention when they want it.
All right, Judith.
Fencing, you don't hear about fencing very often.
That's right.
I haven't heard about, that's amazing. That's great.
Well, I fenced in college, and so then my wife decided my daughter should follow in Daddy's footsteps. And although, if you excuse the digression, the reason she's fencing this weapon is there are three weapons: foil, epee, and saber. Saber and foil are both quite flexible weapons. The epee is the 18th century dueling sword, and it has a triangular, very rigid blade. And so even with your equipment, when you get hit, it hurts. You get great big bruises. So there's a great incentive not to get hit. You want to hit, not be hit, because you go home with as few bruises as possible. But it turns out that the Ivy League schools are often looking for female epee fencers because it's a painful weapon. Teenage girls tend to quit during their high school years. They get more interested in boys than bruises. And so...
boys are more painful than bruises.
They are. It's usually emotional bruises.
Different kinds.
Yes,
right.
yes.
So the idea being that my wife wanted her to take up epee and stick with it through high school, because then the Ivy League coaches are always searching the national meets for good girl epee fencers. So, and she's already got some basic national ratings. So she's moving along at age 13. Anyway.
Love it.
Oh my gosh, that's great.
Yeah, a lot of planning.
So, yeah. Anyway, back to your questions instead of Dr. Mixon's distractions. We measure in our typical patient. When you come to Longevity Medical Clinic, you will typically get in your first evaluation a 70-some page printout. We measure stuff that your family doctor has never measured in their life. Okay. And we are looking at the levels of 8 different hormones, not just testosterone or estrogen and so on. We've 8 different hormones we look at very carefully. And our goal is to readjust your levels to where they were when you did best in your youth. So we don't accept quote normal. We're shooting for optimal. Where will this person function and feel the absolute best? And those are the values we look at. And that was when I started this clinic nearly 30 years ago. That was almost a heresy. They only gave women estrogen and they gave men almost never testosterone. To measure all of the 8 primary hormones and move them all back was really considered pretty weird. Now, 30 years later, more and more people are doing what we were doing 30 years ago. We had a caller earlier who's seeing a naturopath who measures, a lot of hormones. But what we've now done is we're now moving ahead another big leap. Things we've started doing now with senescent cells, other doctors will be doing 30 years from now. But right now, the only place you're going to get it is with us. It turns out that every cell in your body, in your brain, your heart, your lungs, your kidneys, your bones, your skin, everything has these cells that go senile. These cells stop functioning as they should. They start actually kicking out anti-growth, anti-inflammatory chemicals into your bloodstream that actually recruit other senile cells and prevent your body from healing and repairing. And as these build up with age, you have more and more trouble repairing the damage of day-to-day living. And the reason your hormones are declining with age, it turns out, is because these senile cells are actually invading all of your tissues, including your gonads. Women's ovaries function less and less well with age because they have these senescent cells, these senile cells building up in it. Our brains go downhill. We get that age-related cognitive decline in large measure because our brains are being invaded by these senile cells.
Dr. Mixon, I had a 38-year-old male patient ask me if senescent cell therapy would be good for him.
Well, he wouldn't require much, most likely. The problem is that right now measuring senescent cells is very difficult to do. And there are no commercial labs in the country that will measure them for us. So if we send it off to Quest or LabCorp and so on, they can't do it. So I'm actually working with my consultants right now to make our lab be able to actually measure the number of senescent cells in your tissues.
Setting a precedent. That's awesome.
Yeah. Well, I like to stay a couple of decades ahead of my colleagues. And so what we're going to be able to do, right now we just know based on nomograms at a certain age, you probably got about X or Y amount of senescent cells built up. And so we're treating people at the moment to remove their senescent cells based on their age and their function. I'm hoping that somewhere next year, I'm shooting for June or July, I may or may not make that goal, getting a lab set up where I can actually measure with a simple blood test the number of senescent cells built up into your immune system. And that'll tell us how effective our therapies are and how aggressive we need to be with any given individual. So I can treat you for a while, and then I can test you, and then I can say, gee, we're only halfway to our goal. We need to treat them aggressively some more. Or with that younger person you mentioned, we only need a much less aggressive program. So that's our goal. But we are probably one of only about 4 clinics in the whole country that are doing this right now.
Oh, that's wow.
Yeah.
That's great.
Yep. That is our goal. We want to, again, stay ahead of everybody. So I want your heart, your lungs, your brain, your kidneys, your bones, your skin. I want them all to work far better than is so-called normal. I want you to function as well as you did decades ago. And that's what we do at Longevity Medical Clinic.
Yeah, there's so much we don't know. You know, we out here as patients, you know, just don't know. We don't know what we don't know.
Well, and these are things that most doctors
I try to
don't
be a
know.
regular. Yeah, I know. Yeah, tell me about it. I try to be a regular listener on your program. So I appreciate your time and your expertise. Thank you so much.
You're welcome, ma'am. Take care. Bye-bye.
Thank you for the call, Judith. We're going to head to Silverdale right now. We have Ed on the line. And if you'd like to get through too, here's that number, 1-800-465-8770. Hi there, Ed. Welcome.
Hello, Ed.
Thank you. And good morning, everybody. And Dr. Mixon, congratulations to your daughter on that first win.
Well, thank you. I know she's happy. So
yeah, I'm sure she is. Okay, the reason... Go ahead.
No, I'm done. Feel free.
Okay. The reason that I'm calling is I have been listening to Dr. Gundry for probably a few weeks now, and I'm wondering what the doctors there think about his philosophy on the gut. And I'm not interested in the pills that he's hawking, but I am interested in the diet that he prescribes and the reason why. Can you talk about that, please?
Yeah. Dr. Gundry espouses the idea that lectins are a big source of issue for gut health, right? And a lot of other problems that arise from that. Working in an IBS clinic before I came to Longevity, I found a lot of those people would have problems with various foods. But most of those went away when we addressed specific allergens and GI issues like gut bacteria overgrowth and things like that. Many times they did not do better when they took a lectin blocking supplement or reduced lectin. So, but some people did. So I think it's a case of, like everything else, it's not for everybody, but it does work for some people. It's kind of like the low FODMAP diet. It works for some. There's a lot of good evidence for that, but it doesn't help everybody. Unfortunately, that doesn't help you specifically because we don't know if you're one of those that does or doesn't. But one thing you can try is a low lectin diet or a lectin blocking supplement and see if you feel better that way.
That's interesting about the lectin blocking supplement.
Tell you what, let's address that when we get back. But we're getting break signaling from Lynette. So we'll take a break and we'll come right back and we'll take a look at it.
All right. We will take a break and we will be right back. We promise. You're listening to Leading Edge Medicine. We're here until 10 o'clock. If you've got a question for the doctors, call now. Our phone lines are open at 1-800-465-8770. Taking a break and we'll return. Stay right there.
Leading Edge Medicine. Leading Edge Medicine. Don't believe the lie that you have to fall apart at the normal rate and see what your options really are at lmclinic.com. lmclinic.com. Stay tuned for more of the show.
If you have chronic pain and are considering stem cell therapy, consider the only doctor with over 30 years of experience with pain medicine techniques, including stem cell therapy. And that's Dr. Daniel Nelson, MD, with Eastside Pain and Regenerative Medicine. Here's what a satisfied patient had to say.
I would say Dr. Nelson is a great guy. He's very personable, makes you feel very comfortable, as does the staff. Everything went well. I had the stem cell injections, and within a month, I really had a change in my knee. It was unbelievable to me, honestly. I thought there'd be more pain involved with the procedure, and there was hardly any. It was amazing, and I've told a lot of people about it. After having it for 2 years now, it worked tremendously. Glad I did it.
You should consider stem cell therapy, but call a medical doctor with experience. Dr. Daniel Nelson, MD, 425-823-4000. That's 425-823-4000 or danielnelsonmd.com.
Meet Sarah. She tried one of those online weight loss programs, filled out a form, got a prescription, and a few weeks later, she felt dizzy, weak, and frustrated. No one was checking in. No one was making sure the plan was safe for her body. That's when she turned to Longevity Medical Clinics. Our medically supervised GLP-1 program helped Sarah lose weight safely, while we monitored her progress every step of the way. Today, she feels healthier, stronger, and more confident than ever. At Longevity Medical Clinics, we believe weight loss isn't just about dropping pounds. It's about restoring your health, with real doctors, real monitoring, and a plan that works for your body. If you're serious about losing weight and you want to do it the right way, Longevity Medical Clinic is here to help. Call Longevity Medical Clinics today at 866-86-YOUNG or visit lmclinic.com for your free health analysis. Longevity Medical Clinics. Safe, supported, life-changing. lmclinic.com.
At Longevity Medical Clinic, we're always looking for ways to better support your health journey. That's why we're excited to share that Longevity Development, our business and marketing arm, has entered a new management relationship with Paramount Pharmacy. We can't tell you where to fill your compounded prescriptions. That's entirely your choice. But for years, we've confidently recommended Paramount Pharmacy because of their excellent quality control, competitive pricing, and outstanding customer service. And now with this closer collaboration, we're working side by side to make your healthcare experience even better. To celebrate, Paramount Pharmacy is offering a 30% discount on your first 90-day supply of compounded medication for all new patients. Interested? Just call Paramount at 425-251-1660. That's 425-251-1660. Paramount Pharmacy and Longevity Medical Clinic, a team approach to better health care.
We are back with more Leading Edge Medicine. So glad you joined us today. If you've got a question and you're like, oh, I wish I could ask the doctors, you can. We are live in the studios. Dr. Samira Umat here, Dr. Jerry Mixon, and Dr. Ken Pentland. Here's that number to get through today. We have about 25 more minutes. 1-800-465-8770. And we're talking about Dr. Gundry's diet.
I think they were talking about lectin sensitivity and how that can create things like leaky gut and problems, GI problems, and the associated aftermath of that. One of the things Dr. Mixon and I were talking about during the break was probiotics and how something like a seed probiotic can be helpful to help support gut integrity. Yeah. And I was thinking that would be a nice thing to add, but also maybe adding something like a marshmallow root supplement to help soothe and provide some mucilage for the bacteria to stay in and heal the gut lining.
Yeah, Dr. Gundry, he has a good point in that some people are sensitive to lectins, but not everybody. And there are societies in which actually beans and and high lectin compounds are the primary components of the diet, and they also happen to be blue zones where people live the longest.
Yes.
So yes, what he is saying is true for some, but not at all true for a lot of other people. So like many people, he kind of picks a thing that is a piece of truth, but then he becomes an enthusiast and makes it broader than it should be. You know, life is usually more complex than one food, one lifestyle. The good Lord built us according to the same general plan, but there's a whole lot of individual variation within that plan. So I have always said we humans are omnivores. We are designed to eat anything that doesn't eat us first. And if you look around all of human history, humans can survive on almost any diet. I mean, almost anything. You know, a high-fat diet is tough for most of us, and yet the Inuit peoples up in the Arctic, you know, do great on incredibly high-fat diets. You know, with blubber for being hundreds of years being their primary calorie source. You know, so we all evolve to fit our environment over time. And in a place like America, where we have attracted people from all over the planet, we are an incredible hodgepodge of genetic traits. And it's almost impossible to say about anything that's going to apply to all of us. So we need to be careful about overgeneralizing when it comes to diets, when it comes to supplements, or even medications. But you know, one thing Dr. Gundry, I think, has a good idea, and that is the tributyrin. In his supplement, he only has one bacterium, and that is Bacillus coagulum. But he also adds some tributyrum, which is a compound that is made in the gut by multiple strains of bacteria. But it is very good at healing those loose junctions and tightening them up in the bowel so we don't absorb the proteins that cause us having so many autoimmune problems and inflammatory problems. But when I've looked at who makes the best supplements, and warning, I do not own any part of the company I'm about to mention. They don't pay me diddly squat. I discovered them because I was thinking about making our own probiotic. And so in my process of research, I came across this company called Seed. And Seed does such a fabulous job that I looked at them and said, they're doing better than I could ever do. So I just recommend them. I don't try to compete with them because I can't. They got it right. The downside is it's pricey.
Yeah.
It's not inexpensive.
Good probiotics are generally going to be pretty expensive.
They are, yes.
Well, and this one actually has a mixture. Most of these are colon bacteria, and colon bacteria thrive in the colon, which is not acidic. There's no acid down there, and it has a very low oxygen tension. So they are anaerobes that live best without oxygen, and they don't tolerate acid. So to take it as a pill, they've actually given them a pill within a pill. They put the bacteria within a capsule that dissolves in a neutral to alkaline environment, and then they put that in an acid-resistant pill as an outer shell. And so you swallow the one, it gets it through the stomach into the bowel, and then the second one doesn't dissolve till it gets way down the gut, almost to the colon.
Interesting.
And releases the bacteria where they do the best job.
Yeah.
And but that's, again, drives the cost way up.
Sure. Yeah. Yeah.
So anyway,
I just spoke to a patient yesterday, and she started using it and noticed an immediate improvement in her GI habits.
Yeah. So, you know, when I'm looking for something to fix people's leaky guts and so on,
yeah,
I go to Seed rather than Gundry. Okay. Right. All right.
Is that helpful for you,
Ed?
Yes, it is. And I have just one more quick question on the same topic, and that is, is prebiotics really needed to go along with probiotics?
You can get prebiotics from the diet.
Yes. In the food you eat, yeah.
It's just basically fibers, soluble fibers of different kinds. Different kinds will feed different kinds of bacteria. So sometimes you can do a stool test to see which bacteria or which short-chain fatty acids you're low in, and that will inform which kinds of fibers you want, like inulin.
Remember, I told you that we humans can live on almost anything. We do best with the widest variety. Yeah. Because our guts and metabolism are designed to handle a little bit of anything and everything. The wider range of stuff you put down your gut, the better you tend to be. And when it comes to prebiotics, you're mostly looking at fruits and vegetables.
Yeah.
You know, wide range of vegetables, things that have lots of fiber, things that go crunch when you bite them.
Yeah.
Right?
Well, what I'm hearing is prebiotics is really food for probiotics.
Correct.
Exactly.
Yes, it is.
Yes.
The prebiotics are the things, the bacteria, and probiotics are bacteria. So the prebiotics are the fiber, the probiotics are the bacteria that grow from eating the fiber, and the postbiotics are the compounds produced by the bacteria in our gut.
Those are the short-chain fatty acids and things.
And things like the tributyrin.
That we cannot sometimes not make ourselves, and are essential.
Right. So, so there's three forms, but basically start with the prebiotic, that is, eat lots and lots of wide-ranging stuff. Don't narrow your diet too much, and lots of veggies. You know, meat is the highest quality protein, but you don't need enormous amounts of it because our ancestors were not very good predators. Look at your fingernails. Those claws are pretty pathetic, okay? Your fangs are not going to kill much of anything, okay? So we are really deficient in tooth and claw. So our ancestors did not eat a lot of meat. All right. Hope that helps.
Yes, well, thank you so much for the call.
I appreciate all your input.
Okay, take care, sir. Bye-bye.
All right, we'll keep going, doctors, because we've got lots of calls here. We're headed to Des Moines. We have Dawn with us. Welcome to Leading Edge Medicine, Dawn.
Hello, Dawn.
Good morning, guys. How you guys doing? Dr. Mixon, I ran into you at the Bella Medica parking lot, and I was very impressed with your presentation. You've told that story many times.
All right.
I love that.
Well, we're doing okay. Yeah.
Okay, so my question is, I've been a longevity patient for approximately 3 years, and I've been engaged in senescent treatment most of the time, and I've had fantastic results. I want to get on a regular program so I don't have to beg Dr. Jimenez that if I can take it again.
Yeah.
Yes.
Yeah, we have approved that, Dawn. You can ask her for it. Dr. Cho is writing off for those prescriptions now, and you can use one capsule every week, 1 day every week.
Yeah.
Oh,
wow. Like you, I did the 9-day course several times.
Yeah.
And then I started looking for, what do I do long term? And the best one I've found thus far is once you've lowered your levels with the aggressive therapy 2 or 3 times, then we just put you on 1 pill per week. And of course, that depends on how well you tolerate it. My wife doesn't even know when I put it in her pill pack. She has no symptoms at all. I get kind of tired the day after I take it. Some people get a little minor headache. So
I get a little minor headache, but not a big deal. I mean, I'm going to take it. That's not going to stop me.
Yeah, take the 3 quercetin on that same day. If the headache bothers you, take a Tylenol. And then once you've been on it for like 5 or 6 weeks, take 1 week off and then keep going for another 6 weeks. So I've been filling for 12 capsules for 3 to 4 months now for my patients. So I've started that process for my patients in Kirkland.
So seeing them about every 3 months and refilling it. Yeah.
Yes.
Yeah. And
okay, so I take quercetin 1 pill daily. Yes. However, when I'm on the senescent protocol, I increase that to 3
Correct.
That's right.
days I'm taking the senescent cell. That's correct?
That's absolutely right. Yes. So, if you're like my wife who gets no symptoms, well, it doesn't matter when you take it. If you're like me and you're a little tired the next day, then I try to take it on a day that I'm not going to be working real hard, So I and so
you schedule it.
I schedule it. I know that every Monday I take my rapamycin. Every Thursday night at bedtime, I take my dasatinib quercetin. And I take it at bedtime because I know that my blood levels will have dropped by the day, and so I'll be less fatigued.
Yeah.
So I don't take it in the morning and get the high blood level when I'm trying to be active.
And similarly for the headaches. So you get the headache during the course of the night. It should be less of a problem during the next day.
Precisely.
Okay, I take rapamycin. I take it every Saturday. So there's no problem taking senescent cell and rapamycin the same week?
No, I take them the same week. I don't take them the same day.
Okay, got it. Okay.
Yeah, the rapamycin
fantastic.
level drops.
I'm really excited about it because I don't think there's anything I can't accomplish after being a longevity patient for 3 years. And I'm serious.
Well, I'm glad. That is exactly the attitude we're shooting for is, We want that brain function. If the brain don't work, the rest don't matter. And we want your brain functioning like a young, aggressive man with self-confidence and drive and ambition. And then we want you to have the body, to cash the checks your brain writes. So
I don't care about
my brain writes a lot of checks, Dr. Mixon.
I leave those to Sunil.
I can't cash them.
Get with it, you guys. Come on.
Aside, this is
Dr. Mixon, I briefly spoke to you in the parking lot regarding Think Factor. I've been taking it for 3 months. It's noticeable. My mental faculties have improved noticeably.
Well, that's what we're seeing, actually, as we're doing the test. I've got a bunch of tests. I offered it to 100 people that listen to the radio, and we tested their cognition before they started it. We tested it at 3 months, and about 96% of them are showing significant improvement. There's a few that aren't, and I can't help wondering if those few are actually taking it faithfully or not, because I have no way of knowing that they actually take their pill every day,
Yeah.
But the vast majority of people are getting significant improvement at 3 months, and we're going to be testing them again at 6 months.
That's where I'm at right now, yeah.
Yeah, and at that 6 month level, we want to be doing the second set of tests to see how they're doing.
Yeah.
So,
very good. Thank you very much. I appreciate what you guys do for us.
You're welcome, sir. We're delighted to do it.
Thanks for the call, Don.
Have a good day.
You too.
Bye-bye, sir.
All right, headed to Tacoma. Randy is on the line with us. Welcome to Leading Edge Medicine, Randy.
Hello, Randy.
Good morning, doctors. My question is about amyloidosis. My cardiologist has diagnosed me with it, and I'm wondering what kind of information you doctors know about this protein disease. And I was wondering, does it cause memory problems? Will it?
Yes.
Will it cause?
Yes, it certainly does.
Alzheimer's.
Beta amyloid buildup with tau tangles is kind of pathognomonic for Alzheimer's disease. Yeah. Although we've now got, for the first time, a really good test for that. Mm-hmm. We can do a blood test that will measure the phosphorylated
p-tau. Yeah.
Well, that's what the phosphorylated tau 217 in your blood will tell us where you are in that Alzheimer's progress. So we actually can now measure that before you have any symptoms, which is really kind of a nice thing to do. Well, I guess it's nice.
Well, it depends upon what you're going to do with that information.
Yeah. Well, the worry is if you do it through your regular doctor through insurance and it's positive, then you've got your insurance company basically makes it a public issue that you are getting Alzheimer's disease, and you won't be able to buy life insurance or anything, or health insurance for that matter. Nobody wants you in their insurance program if you're going to die of Alzheimer's.
Yep.
Yeah. So, if we order that test for people, and of course we have patient confidentiality. If you don't tell us to give it to someone, we keep your private information private. But if we do it, you got to pay for it out of pocket.
Yeah.
Because if your insurance company pays for it, they get the answer. So.
Yeah, they wanted. Go ahead.
Go ahead. Sir?
Yeah, what was that, Randy?
Oh, no, I just said go ahead. I thought you weren't finished. Well, yeah, so I seem to be having memory problems already. That they wanted to go into my heart and take, what do you call a little piece of it? What do you call that?
Biopsy.
Biopsy, yeah. And, of course, I just thought that sounds awfully extreme. All of a sudden, they weren't talking about amyloidosis to me. And they just said, oh, you'll feel better. Well, what? And so I was putting it off. But now, all of a sudden, I have weight loss, unexplained weight loss, and I am having a little bit of memory problem that I didn't think I had before. Now, I exercise and I eat healthy, but I don't know. What can I do to prevent this from progressing? What ideas do you have? I know you have that think factor.
Well, Think Factor doesn't fix.
Yeah.
Think Factor is designed for normal age-related cognitive decline. Everybody's brain slows down with aging, and so Think Factor is for that. Yeah. It's not a cure or treatment for Alzheimer's.
Yeah.
But amyloidosis is different from Alzheimer's too. They both involve amyloid deposition, but the amyloidosis tends to lay down protein complexes throughout your body. So they lay it down in your heart, your muscles, your lungs, everywhere. And
you mentioned the cardiology component, and there is this new drug, ATTR, cardiac amyloidosis. And that is something so specific that I've only seen commercials of it. That's something maybe your cardiologist can help you with, because those are commercials I have seen on TV. And so
Morgan Freeman does that ad. Yeah.
Yeah. Yes.
Or what is it? A Truby. I think they called it a Truby.
Yeah. Well, there's a difference of the brand name and the chemical name.
Right.
So Truby is the brand name, and Dr. Umat is talking about the actual chemical.
Yeah.
So,
They have me on Vindamax. It's tafamidis. Vindamax they have me on.
Again, this is a highly specialized field, and it is outside of our purview, my friend. We are our specialty is the normal but undesired changes of aging. So we're really good at just old folks getting older and trying to make you function better. When you start getting into things like amyloidosis and Alzheimer's, you're moving out of our range.
Yeah, okay. Well, I just wanted to know, what you know a little bit about it anyway.
Well, I think you've already got most of what we know about it.
Yeah.
You're a good listener, Randy.
It sounds scary, yeah.
Yes, it is scary.
Yeah, because I'm thinking, God Almighty, I was going along okay. I'm 82, but now I got this compound. I had a heart attack and bypass, causing a bunch of problems, but I have nothing to look forward to here, doggone it.
Well, I wouldn't say nothing.
Yeah.
But you do need to be under the care of people that specialize in your problem. And that's not us, I fear. So, get back to your cardiologist and follow his instructions, okay?
You think that just staying healthy would help keep it from progressing so fast? Or I don't know.
It certainly doesn't hurt. Yeah, I mean, anything we can do to make you stronger and healthier and fitter and to improve your immune response is going to give you your best shot. But it's not going to be a cure for the specific disease. It's just kind of ancillary, helping on the margins.
Yeah, it's what do you call? You get it from your relatives. They're saying, what do they call that too? But yeah.
Yeah, your genetics,
you inherit.
Epigenetics.
You inherit it. Yeah.
Yep.
Okay, thanks a lot.
Okay, take care, sir.
I'll be getting into your clinic next year. Maybe I'm thinking of joining your clinic next year.
Well, let's see what we can do for you. Again, can't promise to cure that particular problem, but we'll do what we can, all right?
Yeah, good. Thank you very much.
Okay, take care, sir. Bye-bye.
Bye-bye.
Aw, thank you for the call, Randy. And we still had another couple of calls. We'll try to get those at the beginning of our next program. So,
that's right. We've been almost 2 hours here, haven't we?
Solid phone calls.
Yeah.
And we do want to remind you that we would love to see you in our clinic. And you don't have to wait until next year. Maybe even use some of those, what are they, the health? HSA, the health savings account.
Or the flexible
spending that you may have at your work. Most of those need to be done by the end of the year, and that using longevity for that is a wonderful way to use that. Maybe you could explain a little bit more about that.
Well, there are a couple of government programs. There's the flexible spending accounts and the health savings accounts. And these are tax-free money that you can set aside to use for health care. And we qualify for that. Insurance doesn't cover what we do because we're treating normal aging. And insurance is only for diseases, not for getting older. But you can use it for our care. And actually, even if you're starting us late in the year, our year for you starts the day you start with us.
Right.
And we actually give people a discount for paying the year in advance.
Mm-hmm.
And so if you've got extra money piled up in there that you need to spend before the end of the year, you can pay all the way through to the end of 26 and do it with tax-free money, which, depending on your tax category, you might be able to save a fair bit. So
very good. All right, there we go. We have just a few minutes left. Doctors, would you like to share any more information? Dr. Pentland, do you have some last words for us? Just a few.
Make sure you stay well hydrated.
Yes, especially in this season, because we're coming into the cold and flu season. And we want you to be as healthy as you can. And we got 50 seconds.
Well, for those of you following my daughter's fencing,
yes,
she just won her second match, 5-2.
Oh, wonderful.
So she's won them both so far. She's probably got 3 more before she goes to DE. But anyway,
it's a force of nature.
She's working on it.
Woohoo! Okay, I would say that's very good to talk about.
Yes.
Thank you, Dr. Samira Umat, Dr. Ken Pentland, and Dr. Jerry Mixon. Thank you so much. And our engineer is saying, woohoo, 2-0, undefeated. She is officially undefeated.
So far.
Oh, yes. And thank you so much for tuning in today to Leading Edge Medicine. We'll be back again next week. So if you didn't get through today with your calls or your questions, or maybe you heard something today you'd like more information on, give us a call next week. We will be live in the studio. Enjoy the rest of your weekend, and we'll see you next time on Leading Edge Medicine.
GLP-1 weight loss medications are powerful, but without medical oversight, they can also be risky. At Longevity Medical Clinics, we don't believe in shortcuts. We believe in real medicine, real monitoring, and real results. Our GLP-1 weight loss program is personalized to your biology with lab work, ongoing adjustments, and medical professionals guiding you every step of the way. Here's the truth. These medications can suppress appetite and help you lose weight. But if no one's monitoring your heart, your blood sugar, or your overall health, you could be putting your body at risk. That's why we test, track, and fine-tune so your results are safe and sustainable. If you're serious about losing weight and you want to do it the right way, Longevity Medical Clinic is here to help. We combine the power of modern medicine with the confidence of medical oversight, so you can focus on feeling better, stronger, and healthier. Call 866-86-YOUNG or visit lmclinic.com to schedule your free health analysis. Longevity Medical Clinics.
Are you ready to get rid of your reading glasses? Or maybe as you're getting older, and we all are, you just want your vision to be the best it can be. It's time to look into refractive lens exchange at Northwest Vision Institute with Dr. Michael Gilbert. RLE is performed in the same process as cataract surgery. The natural lens is removed and replaced with a high-tech intraocular lens implant. Basically, what that means is your vision will be crystal clear, you'll be able to see far away or up close or both. The difference is incredible. Imagine. No more contact lenses. No more searching for the reading glasses. Most likely, these will be the last lenses you will ever need. RLE is just one of the services offered at Northwest Vision Institute. Come in and see Dr. Michael Gilbert and his team at Northwest Vision Institute. Call 425-450-2020 or online nwvision.com.
Seattle Red on 770 KTTH Seattle, 97.3 KIRO FM, HD3 Tacoma Seattle, 94.5 K233 DT Eastlake, 33 BU Seattle.
FlightAware's misery map. This, by the way, happening with a 4% reduction in flights in 40 airports. Transportation Secretary Sean Duffy says that number could go up if staffing shortages continue.
This shutdown doesn't end relatively soon. The consequence of that is going to be more controllers don't come to work, and then we're going to have to continue to assess the pressure in the airspace and make decisions that may, again, move us from 10% to 15%, maybe to 20%.
Still, a lot of travelers say it is time for Congress to reach a solution.
And that's Fox's Madeline Rivera at Reagan National Airport in D.C. Meantime, lawmakers will try again today to cut some sort of deal and reopen the government, but it's still unclear, many say, if both parties can make any headway.
Wheels are turning behind the scenes, but it's unclear if a weekend session can reopen the government. There's a plan to run the government through the end of January. It also funds the Department of Veterans Affairs, ag programs, and Congress until next fall. It needs 60 yeas. Now, Senate Minority Leader Chuck Schumer offered a straight funding bill yesterday, but he tacked on a year-long extension of money for Obamacare. Republicans flatly rejected that. Democrats also blocked for a third time a bill to pay government workers. Democrats believe that bill gave too much power to the president to pick who gets paid. Senate Republicans are hopeful they can get a test vote this weekend on the new temporary spending plan.
And that's Fox's Chad Program on Capitol Hill. America's listening to Fox News.
I'm Emily Campagno, and I'm taking you inside the Idaho murders. In Moscow, Idaho, a small college town, one case so violent and heartbreaking shocked the nation. 4 students were found brutally murdered in their off-campus home, prompting a cross-country search for the cold-blooded killer. The Fox True Crime Podcast presents Inside the Idaho Murders, the evidence, the manhunt, the killer, and the victims.
Listen and follow now at foxtruecrime.com. Every weekday, it's your go-to source for staying informed and entertained. The Fox News Primetime Highlights Podcast, offering a curated selection of the most impactful moments of the Ingram Angle, Jesse Waters Primetime, Hannity, and Gutfeld. Listen and follow now so you never miss a moment of the action-packed highlights from these must-watch Fox News Channel shows. Go to foxnewspodcasts.com or wherever you listen to podcasts. America's listening to Fox News.
The following paid program on this station is pre-recorded.
Chris Longworth is a certified financial education instructor and provides general information, not individually targeted, personalized advice, and is not liable for the usage of information discussed. Exposure to ideas and financial vehicles should not be considered investment advice or a recommendation to buy or sell any of these financial vehicles. This information should also not be considered tax or legal advice. Chris Longworth is a licensed insurance agent in life and health products in 22 states. Individuals should consult with a professional specializing in the fields of tax, legal, accounting, or investments regarding the applicability of this information for their situation. Past performance is not a guarantee of future results. Investments will fluctuate and when redeemed may be worth more or less than when originally invested. Any comments regarding safe and secure investments and guaranteed income streams refer only to fixed insurance products. They do not refer in any way to securities or investment advisory products. Fixed insurance and annuity product guarantees are subject to the claims paying ability of the issuing company and are offered through the Financial Education Group. By contacting the Financial Education Group, you may be provided with information regarding the purchase of insurance products.
It's not enough to have a retirement plan. It needs to be the right plan for your lifestyle, longevity, and how about some legacy? In today's class, we'll highlight the warning signs that your current plan might be outdated, underpowered, or based on faulty assumptions. If you want your senior years to be your best years, this class is for you. Grab your seats, folks. Class is about to start.
Welcome to The Money Professor with Chris Longworth. Chris provides critical retirement planning here.
It's exciting to watch people gather that knowledge up and then start to apply it to their own situation.
And a comprehensive review is made available to you.
And it's wonderful when all of a sudden the light goes on. Now they have confidence in the decisions they're making. If you plan well and plan correctly, every day of your retirement life will be like a Saturday.
Chris Longworth is the Money Professor.
Welcome into the show. We've got the Money Professor here, Chris Longworth. He is wearing a Hawaiian shirt today for the show today. How are you doing, Chris?
You know, Jackie, aloha to everyone listening. Doing some field work. My brother lives in Hawaii during the wintertime, so I have the wonderful pleasure to be able to get over here and set him up in the early November, and then he stays here all winter long. And we get to travel back and forth. The family gets to come and see and visit and have a nice warm place to get out of the cold. So very much look forward to that. And that's what we're doing this week. And again, just to have that opportunity to be with you guys today on the show and talking about certain topics just, again, thrills me to no end to be able to do that and have that extra bit of knowledge that we can share. And today's class is going to be particularly important and interesting as well, because we're going to talk about some things that all week we've had clients calling us and raising questions about and really wanting to know more about some very particular topics. And as you heard in the opening there, what about longevity? What about outdated ideas? I mean, are you stuck? Is your plan stuck in the 1980s, 1970s? Maybe worse yet, it's stuck in the 1990s.
Yeah,
that's even worse yet.
Floppy disk era, right?
Well, I mean, that was the boom year. I mean, the market grew each and every year for 10 years straight. Everybody thought it was never going to end, and then the dot-com bubble burst, and that was the cycle of another 10 years of crazy volatility that literally wiped out trillions of dollars in savings and retirement assets, and people were decimated. I mean, that decade is known very well as the dead decade. Lots of articles and books have been written about it, and we're going to talk about a little bit of that today. I have been doing some reading, as I love to do on this topic in general, is taxation. Now, think about this. Let's say that you're blessed with longevity and you have longevity in your family, right? You're going to see 90, maybe beyond. And you have an IRA, traditional IRA, and you are happily don't need it. You've planned well, you've done well. You don't need that account, and so you're going to let it sit as long as possible. And then the day comes, 73, and now required minimum distributions kick in, and now you really didn't think about it up until this point. Really wasn't a thought. You knew it was there. You knew this thing. You knew the event was coming, and that was all the thought that you gave it. You didn't think beyond that point. So let's take a moment and just think beyond that point, and here's what's going to happen. You've waited till 73. RMDs kick in. That required minimum distribution now is going to put you across the income threshold. You were happily below, as a married couple, you were happily below the $96,000 a year income threshold and paying 12% on your taxes, and you are just happy as a clam, lowest bracket. What could be better? And then 73 comes, and now all of a sudden you've got an extra $45,000 or $50,000 a year coming to you, and it pushes you straight over that line. And not just over the line, but your tax liability doubled. You're now in a 22% tax bracket. You went from 12 to 22%. That's an ouch. That's an ouch moment. I mean, so Jackie, again, we're going to talk about the conflicts that are built into some plans. We're going to focus on those conflicts and how they are literally in opposition to what we said in the very beginning: your lifestyle, your quality of life, the longevity, how long you may live, and the desire to leave legacy. All are conflicts inside traditional 401ks, traditional IRAs. Those three conflicts exist. And like we've always said, when you have conflicts, to work with that, you have to have compromise. And to have compromise, that means you have to give up something. So now the question becomes, what are you willing to give up in this compromise to be able to have those conflicts resolved? Well, I would say probably let's get away from the conflicts altogether. Let's find a way that we don't have any conflicts in our plan. Let's simply remove the conflicts and replace those conflicts with some certainty.
Great.
Defined benefits, a defined benefits distribution plan, right? Personal pension type plan could replace all three of the conflicts that are built within. So today we're going to do a little book report, right? Okay. I love sharing information with folks, and this is a book that I have shared before. It's one of my favorites, and it is simply called The No Compromise Retirement Plan. I'll say that again. The No Compromise Retirement Plan. Underneath that, it says overcoming the compromises in your IRA to live a more secure retirement. It's written by Martin H. Ruby, who is an actuary. Mr. Ruby is probably one of the best masters of numbers that I've ever read about. He gives the truth and facts of the numbers of all of what he's calculating when it comes to those conflicts that are built in. And he addresses each one with facts and mathematics. And this gives us two advantages, Jackie. Advantage one, we now can broaden our knowledge. And again, knowledge is power. We now become more powerful when we have more knowledge to make better decisions about our money. Number two, we can actually remove the conflicts, and that brings positive psychology to our money and positive psychology to our retirement. So let's talk about those real quick.
Wait, I want to give the phone number.
Please give it to everybody. I'm on a roll. I'm on the lecture stand. Sometimes you got to poke me with a stick, say, Chris, shut up. So, Jackie, go ahead and give him that phone number.
Yes. To reach the Money Professor, his 800 number is up and happening. 800-719-7917. 800-719-7917. Still active, even though he's over in Hawaii helping out his family. The gals are back in the office and taking the phone calls for
They're
you.
still running appointments and still meeting with folks. You know, like I said, this is the wonderful thing about being able to be mobile and have, Zoom and technology is that we can still be in the room together no matter where we are on the planet. So
sure. 800-719-7917. All right, Chris.
And you know what? You might want to try that website, thefinancialeducationgroup.com. thefinancialeducationgroup.com. There's a button there where you can set your own appointment, get right into our calendar if you choose, or call that number Jackie gave you. Rebecca and Morgan are eagerly awaiting to assist you, and those are two of the most wonderful people you ever want to talk to. So
great. Again, it's 800-719-7917. All right, back to our book learning.
Yeah, so little book report, as we like to do periodically. And again, I like to highlight tidbits of information out of the book, and it kind of teases people to want to read the book. It's not a long book. It's about 100 pages long. It'll take you a couple hours if you sit down and just go to it, but it is an interesting read. So it captures you. It's captivating. It really is. It's really interesting to see from that perspective of the numbers makers. These are the people that actually design all the investments. They design all the insurance products. They design all of anything that has to do with money. The actuary is the master mathematician. His fingerprints are all over these things. So understanding their mindset gives us what, Jackie? Why would we want to understand the architect's mindset? The architect, the guy that built the thing, why would we want to know what he knows?
Well, so we can have a leg up, so we can survive this thing called retirement.
Exactly. It's not just survive. We want to thrive within it.
Thrive, yes.
And so you've often heard me talk about financial architecture as a real thing that can be done and needs to be done. And truly, when you take that architecture and take control of it, now you have much better results. So 3 conflicts built in, and those 3 conflicts are simply this: growth versus protection. Number 2, income versus legacy.
Okay.
Number 3, the big one, you versus the IRS.
Oh, dang.
And so those 3 conflicts are built into every deferred type of program. So I will use that term loosely here and interchangeably for this class. 401k, IRA, any tax deferred plan falls under the same rules and auspices we're going to talk about here. So, Jackie, I know we're coming up on a break real quick. And so I just want to turn to the listeners real fast and say, guys, we're about to dive into a really important topic here that you really do want to speak with me about, or someone like me. So please take this opportunity to sit down with me. I'm going to give you an opportunity here for the next 10 people that call in right now. We will give you priority spot on my calendar. Even from the road, folks, I will make time to speak with you and hear all that you are trying to do. And let's make sure that 2 things take place. Your income plan will last all of your life. No matter how long that life is, we must have longevity in the plan, and we must have safety. Number 2, let's find out what is the risk involved in your current situation? Where does the unnecessary losses happen? And can we stop those? If we can stop those, then that just means more income for you. And then let's take a look at that tax plan. What are you going to do with taxes? How are you going to address it? Do you know how much you're going to pay over your lifetime? I can show you the calculation. It is dramatic. And then let's take a look at the customized income plan. Let's use the Wealth Defender strategy, the proven technique to get your safety in place, secure income for a lifetime, and make sure that you have a legacy to hand off. So give us a call, folks. You have priority 10. The next 10 of you that call in right now, you have the pick of the calendar. Jackie, what's that phone number?
Sure. 800-719-7917. 800-719-7917. The show is The Money Professor with Chris Longworth.
Yeah, do it
Don't
now.
leave. We're getting good. We're in the book report
right
here.
Back. Right back.
Chris Longworth, the money whiz, flexing wisdom on the biz. Got a plan for the dough you stack, fixed index, got your back. Every day, Saturdays feel, profess wealth, that's the deal. Retire rich, never broke. Longworth teachings ain't no joke. Stack your chips, hear 'em roar, taxes cut.
Welcome back to The Money Professor with Chris Longworth. 800-719. Yes, back in session. 800-719-7917. Please take your seats. Students, take your seats.
Bueller.
Shuffling in. I was in high school shuffling in from having a cigarette outside with the freaks.
Right during roll call, right? Doing roll call. So we were talking about the book, The No Compromise Retirement Plan, written by Martin H. Ruby, and I want to elaborate a little more on those three conflicts because it's really notable, and it feeds into what we were talking about in that open, that most people have the desire to really maintain a high quality of life. They really want their quality of life to be the best that it can be. Well, that requires cash flow. Right? So if you want to maintain where you are today, then the check you're getting from work cannot stop. You have to have that same check flow to you in retirement. So your income cannot stop, and it cannot diminish, and it cannot change. And so for that, you must plan for that. I mean, I'm telling you right now, folks, we do this every day. We do this every week. We help folks plan these types of programs so that they can maintain their quality of life for all of their lives. And that covers as many lives as you want to attach it to. So looking at what you might be doing currently and saying, do we have an outdated program? Is it underpowered? Is it not performing? Is it risk-based? Am I 100% at risk? That's a problem. You need to adjust and make sure that the current balance of your risk versus reward, and what I like to say, risk versus reality. And the reality is the cash flow must flow. I mean, income must happen. That's the reality. It's not an option. It's a must-have. So we got to plan for that. And so within that, we have three conflicts in those traditional plans. So I'm going to use that term rather generally and say all deferred plans, all tax-deferred plans have inherent problematic situations. We call them conflicts that are built in. And number one is the growth versus protection. And that simply is your desire for the funds to grow so you have enough to maintain that quality of life, and yet you don't want them to be wiped out in the next market crash. You want some protection. You want some preservation in there somewhere. You want to have some kind of a safety net underneath you, right? Sure. How about number two? Number two. Income versus legacy. Now, this is your desire to use the funds for living expenses in your retirement, to actually pay for that quality of life, and the desire to leave some funds to your family, a legacy, something behind. You want to leave something to the next generation, benefit them somehow, right? And then lastly, this is my favorite one, you versus the IRS.
Mine too.
The desire for you to use your retirement account as income, and the government's desire to take its portion of the taxes away from you. So those are three conflicts. Those three conflicts are built into every single plan. And here's my take on this, and this is Martin's, I'm going to read it right out of the book.
Please.
These 3 conflicts in your IRA have a bigger impact on your living standards in retirement than almost anything else. Yet most of us have never tried to overcome them. We assume it's necessary to accommodate them and to plan around them. Well, folks, I'm here to tell you it's not. So there again, you don't have to just accept it because it's the norm. I'm sorry, it's not the norm. You can plan away from it. You don't have to accept it because the person you're working with has no other solution for you. That just means you're not working with the right person.
Right.
And he goes on to really elaborate further. He's talking with CPAs, his own personal CPA, on this very topic. And, you know, he really goes into the strategies that they were talking about, how they both felt like they missed something. And then all of a sudden, when they realized the tax liabilities and how the conflicts are simply built inside these programs that you cannot escape, they got mad. They were mad that they were discovering these things through mathematics and finding it to be an architectural design in the program. And now it spawned them to really try to find solution. And that's what Mr. Ruby did here. He came up with a wonderful set of solutions to take care of the tax liability and understand that investing is not what you think. Investing has 3 conflicts built within it if you're not careful. Those 3 conflicts we just described.
Yes.
And if you really want the best results, you have to learn a few things about index crediting and the safety features that are built there. The fact that your desire to grow money and use money, think about that. Those are, I love how he puts it into perspective, right? Perspective is everything. So he says, typically people will fall into this category because their psychology is not good about their money, right? Psychology is everything when it comes to money. So it goes like this. To understand this bit, read the book. It really is simple, but I will give it to you this way. Simply, and he states it in the book just like this. It's one's desire that, he says, I like cake. I like to eat cake. But I'm overweight and I'm trying to lose weight. So there's a conflict here. My desire to eat cake, and the more cake I eat, the more weight I gain, and my desire to lose weight, and so the more weight I lose, the less cake I eat. And that conflict is inherent in human beings. That is something we have to understand, work through, decide, and literally take action to get away from that kind of thinking. And so I really love how he goes through and gives us these tidbits of information and really makes it relatable to what we're doing today in our daily life. Really does. So the No Compromise Retirement Plan, get it, read it. It's like $12 online and it's 100 pages. It will change how you think about what you need to be thinking about. Let me say that again. It will change what you are thinking about in the fact of what you need to be thinking about. And I had a meeting with a client the other day and he said, Chris, you know what I don't know. So I'm relying on you to tell me what I need to know. Now think about that. That's one of the most honest statements people make to me is, Chris, I don't even know what questions to be asking you, but I know I need to be asking some questions. So can you help me out? Yeah. So again, there's ways to eliminate the conflict, and we just have to understand what those ways are and how we can remove something without creating a void and replace that something with some certainty, maybe even some guarantees, but definitely some peace of mind and better psychology about planning in general. Architectural planning for your income is going to be one of the most beneficial things you can learn how to do. If you want to know more, we are more than happy to help anyone who wants to know. Jackie's going to give you a phone number. Guys, please use that number. We're going to sit down with you, and as you hear me talk about every week, we like to do a very forensic review. We're going to go in depth. Let's take a look at what you're currently doing, if you're doing anything. If you simply just have a pile of assets, we'll point it out to you, and then we will come away with a solution for you. We will not leave you hanging. Let's come up with an income plan that will last all of your life, no matter how long that life is. How about 2 lives, husband and wife?
Right.
How about a legacy that you desire to leave? We'll show you how you can encompass all of those in one plan, make it simple, make it easy, put some guarantees on it. Now you have something. Now you've got peace of mind. Now you've really got an edge that you currently don't have. So give it some thought, folks. There's a lot that we go through. Let's do that risk assessment. Let's really see where the unnecessary losses are happening, and let's stop those. More income for you. Let's do the tax analysis. You will be amazed to find out how much money you're actually going to pay over your lifetime in taxes. It's dramatic, and we can show you the easy solution, and it's even more dramatic. So again, be willing to sit down with us and understand and learn some things, folks. It will open up your mind. It will give you some knowledge, and with knowledge, there is power. And with power, you get to employ some smart money management skills, the wealth defender strategy. I mean, we'll customize that income plan for you. You'll literally have a roadmap of what to do and when to do it. So sit down with us. The next 10 that call in right now, you'll have priority spots. Jackie, give them that phone number. Guys, you can always go to the website, thefinancialeducationgroup.com, thefinancialeducationgroup.com. Send us an email, send us a text, set up an appointment, call Rebecca or Morgan. They are more than happy and willing to serve your needs and get you on my calendar. Guys, we are just eager and happy to help. Jackie, what's that phone number?
It's 800-719-7917. 800-719-7917. 7917.
Excellent.
Just so you know, Chris can help guide you to make these retirement planning decisions that you've been wondering about. So make the phone call, talk to the money professor himself, get on his calendar. If you want a Zoom meeting, that's fine.
You got to think about the long, think long range, longevity, long-term care. What happens when you get old and you need assistance in your life? How is that going to unload, right? So let's think thoroughly, strategically, and with that idea that you may live longer than you think. So give us a call, folks. Let's sit down and have a chat. I think we'll have some fun. I think you'll like it.
Here again is the number, 800-719-7917. Be right back.
If you're one of the millions of Americans behind on your taxes, if you're afraid to open your mail because IRS collection letters could be coming, listen carefully. The IRS is cracking down, taking paychecks, freezing bank accounts, revoking passports. That's a fact. But here's what most people don't know. There are official tax relief programs designed to help struggling taxpayers. Programs that could save you thousands if you qualify. No one knows these programs better than the experts at Optima Tax Relief. Optima's award-winning team will fight to protect your paycheck, your passport, and your property. Their tax attorneys and licensed tax professionals will work tirelessly to get you the best deal possible with the IRS. Every day, penalties and interest keep piling up, so don't wait. Call Optima now for a free consultation.
Call 800-343-6460. 800-343-6460. 800-343-6460.
Optima Tax Relief.
Some restrictions apply. For complete details, please visit OptimaTaxRelief.com.
With Progressive's collision coverage, my family gets up to $1,000 for vet bills if I'm injured in a car accident. And that makes this Chihuahua really feel like part of the family. What's that? I don't sound like a Chihuahua? Oh, I'm sorry. What exactly am I supposed to sound like? I guess all Chihuahuas are high-strung, riding around in expensive designer purses. Actually, I prefer riding in cars. So I appreciate that my family protects me with Progressive's pet collision coverage. Okay, maybe I am a little high-strung. Progressive Casualty Insurance Company and Affiliates. Not available in all states. Coverage for dogs and cats is included with the purchase of collision coverage and is subject to policy terms.
Wesley Financial Group is not a law firm, and Chuck McDowell definitely not an attorney. This is Chuck. If someone talked you into buying something really silly and you want to get out of that silly little thing, my advice, get the facts. Call me and I'll send you our timeshare exit kit absolutely free. Inside, you'll learn how timeshare works and all your options for cancellation.
Call Wesley now for your free exit info kit. 800-838-6767. That's 800-838-6767.
Hey, this is Pete from What Matters, a show that covers everything having to do with your home. Tune in every Saturday from 2 to 3 on Seattle Red, where you'll hear from local business owners who are experts in their industries. From foundation to flooring, roofing and windows, furniture and financial planning, it's everything in and around your home, and we've got you covered here on Home Matters. If it matters to you, it matters to us here at Home Matters. Saturdays from 2 to 3 right here on Seattle Red, or listen to the podcast on mynorthwest.com.
Teachers are dynamic leaders, shaping a new generation. They bring a variety of perspectives from diverse backgrounds, innovating how they teach to prepare students for our fast-changing world. Achieving this takes skill and expertise. They're tireless explorers, creatively discovering a universe of solutions, telling stories, experimenting, inspiring, mentoring, connecting cultures, and connecting with each other. Leading by example. Experience the unique joy of helping students thrive. Teaching is a journey that shapes lives. Are you ready to begin? Explore teaching at teach.org, a campaign supported by the U.S. Department of Education, Teach.org, and 1 million teachers of color.
Seattle Red, a new experience for Seattle's conservative movement.
The mayor is saying he's going to do an investigation to find out how this happened. What he's doing here is trying to placate a group of left-wing lunatics.
Seattle Red is about conservative values, common sense principles, and growing the conservative movement. Now, on a bigger platform.
We must think big and dream even bigger.
We are Seattle Red. On 770, the Seattle Red app, and seattlered.com.
Welcome to The Money Professor with Chris Longworth.
He created the Wealth Defender system. He is the Money Professor, Chris Longworth, and we have him here on the program, of course. That is the name of the show, The Money Professor, Chris Longworth.
We are just humble financial servants, just wanting to help folks. And again, knowledge is really the key element, because knowledge brings power. When we empower people with knowledge, they really feel better about the decisions that they need to make and have to make. And it's such an important decision that you need to gain some knowledge. You need to understand just a few basics. And we love starting with the basics. It's not hard, budget, writing things down, just simply taking some time to be thoughtful about it,
Yeah.
Yeah.
It just takes a few minutes to make a phone call and to book an appointment. It's no cost, no obligation. 800-719-7917. 800-719-7917. Now, we're book reporting it here on Chris's favorite book. All
now
right.
let's dive in a little deeper into those conflicts that we were talking about.
We don't want conflicts. We don't want conflicts.
No, conflicts we want to avoid. And so this is one that is really, if you stay here, this is unavoidable. And that simply is growth versus the security, right?
Okay.
You want it to grow, but you want it to be preserved. You want to be able to use it. You don't want to lose it in the next market turn or the next crash that happens. You want to have at least some safety nets underneath you. And so in the book, it starts the chapter, and I will read you just a little bit because it is so notable, and I love that he's very real about this information. So I will just put it this way. Does this sound familiar? Ever watch CNBC and get overwhelmed with the advice you hear? Or you read USA Today and have trouble sorting out what it all means? Financial planning can be confusing. It's even harder when the experts can't agree. Here's what we face when we turn on the TV or read the paper. Baby boomers should generally have up to 70% of their portfolio in equities. That's USA Today. So you think, great,
Wow.
I'll put more of my savings in stocks.
That's what everyone thinks.
But wait, no, baby boomers have too much retirement savings in stocks. That's CNN money. Wait a minute.
There's
so
a
do I have
conflict
more?
there.
Or do I have less? I mean, one guy's telling me to buy more. The other guy's saying, no, don't have that. Sell it off and take less. But wait, again, it's conflicts from within. So the other one I love is this. Subtract your age from 100, and that's the percent of portfolio you keep in stocks. That's CNN on the money. And this is getting confusing, and you think, wait a minute, I'll just fall back on the old tried and true method, 60% in portfolio and stocks and 40% in bonds. And then the 60-40 stock bond portfolio mix is dead, and that's motley fool. So no matter what you turn, no matter what you see, no matter how you wonder, how many savers are confused, and at best confused, but at the worst, they're simply fed up. So again, conflicts are built into the thing, and if you don't understand those conflicts, you will get caught up in that melee, like I say, and then all of a sudden your positive psychology goes away, and now you're worried, you're fretting, you're upset, and that's not going to bring good health. And so just understanding a few different things about how volatility works, what it really means to you, the conflicts of inherent in the market today go right against the idea of growth versus safety. Remember, the fact of the tool is the physical characteristic that it has, which is 100% risk 100% of the time, and that is a fact of the tool. So if that's not where you want your quality of life to be, well, then you have to do something different. You have to understand what are the differences and where can you go to plan for income and get a better result. It's just simply understanding what vehicles and what tools are available to you, right? So there are many different ways to look at this, and we can go into the next big benefit is the tax part. I mean, to me, that's the biggest conflict is taxes due on deferred money, because we've shared those numbers before and they share them in the book here. A $700,000 account, just taking RMDs, and you live from, RMDs at 73 to 90, $492,000 is coming out of that account and going to taxes.
Unless you do something.
You can convert the entire account for $175,000 of one-time lump. So if you have the assets, it surely makes for conversation. It really makes for conversation to say, how do we get rid of this problem? And then, again, having the knowledge to know what to do, when to do it, how those actions are going to translate into your quality of life. Does it raise your quality of life or does it take it away? Right? Does it enhance what you're trying to do, or does it stumble you? Does it put hobbles around you somehow? You don't want that. You want to have enhancement. You don't want to have anything else, holding you back or causing your money to not work forward. That makes sense, Jackie?
Yes, it sure does.
So especially if we have longevity, right? I mean, I've shared with many folks before, I am blessed with longevity in my family. I had great-grandparents that made it well past 100.
Wowie.
Right? Yeah. So I know you had some little bit of longevity in your family, and then on one side, the other side, not very long.
Not so much.
You never know what you're going to get, right? I mean, that's not our call. But if we plan for, like I say, plan for the worst and then live with the best, that's the best we can do. How about longevity and long-term care?
Oh,
you
boy.
make it to 95, and you want to stay at home and have comfortable exit in this world. You don't want to go to a home. You don't want to go somewhere. You want to stay home.
You better believe it.
That means private care. Mm-hmm. And to have private care, that means you have to have assets. It's a planned event. Right now, this last week, we set up 3 different programs for folks focused on just that piece alone. Remember, you've heard me talk about how important it is to have definitions on your dollars. Every dollar has to have a definition, a defined thing to do, and a defined place to go, and a defined time to do it. If you have that, you get such better, so much more out of those dollars. And so this last week, we set up 3 different programs that are designed to help folks with that long-term care need when they get later in life. And remember, if you fund it yourself, there is no permission. You don't have to ask permission. You just turn it on and enjoy the income and get the help you need, right? There is no qualifying. You are the qualifier. When you set up your own program, it's a whole lot freer to implement and to actually put to action when it's time, right?
Mm-hmm.
So there's real value in understanding some of these things, and then how does it fit into one's life? That's really what we do, is show them how these puzzle pieces fit together and how they complete and bring together an overall picture and complete that picture. So, like I said, planning in this area can be quite notable. In fact, Jackie, why don't you throw that phone number out there? Everyone listening right now, if you would like to know more, Jackie's going to give you a phone number. Please call us and talk to Rebecca or Morgan, and we'll get you on the calendar. And let's find out how a little tax planning, a little income planning, what you can learn and make your situation a little better. Jackie, what's that phone number?
800-719-7917, 800-719-7917. And Chris, we are celebrating this month. It is National Long-Term Care Awareness Month.
It is. That's why we're talking about the best way of longevity and how you plan for that, and the income that's necessary to have longevity, and all these things. They all kind of got to work together, and when they don't work together, that's when it becomes a problem. That's when you wake up that one day and it's sometimes it's a painful moment where you really get a knot in your stomach, and you realize that we're not in the right position, right? I mean, that's a hell of a moment of realization. Sometimes it's fixable if we can get to it early enough. Unfortunately, oftentimes it's not fixable. It's the start of and the spiral of the law of diminishing returns, where you're using the money, volatility is consuming it, and you start to consume it at a rate that it can no longer grow back, and that's it's a tough spot to find yourself in. There may be some fixes to that. There may not be. It just depends on what's available and what your willingness to take action to fix it, right? So planning carefully. This is where the budget really can be the thing, guys. And I say it every week, and I'm not joking about it. And all week long, we did that exercise with folks. Take a piece of paper, take a pencil, and literally physically write it down. What do you want your retirement to look like? Don't just think about it. I want you to write it down on paper. Let's bring it to life, folks.
That's important.
Right? It is. Well, Jackie, how many times have you thought about something? And that's about as far as it went.
So many times it escapes me.
If we write it down, then all of a sudden it's real. Now I've got something I can remind myself, hold myself accountable to. It creates responsibility within us. So take that and apply that towards your own retirement life with your own retirement assets, and the fact that you must have. Remember, folks, the opening sentence in one of my favorite classes was called Advanced Retirement Planning, and the opening sentence simply said this: all well-built plans must have 2 basic components at their core. 1 is a guarantee of income option. 2 is enough cash value life insurance to cover the inevitable and unforeseeable events of life. So there's your architecture for a well-built plan. There's the blueprint. Have a guaranteed income source, have enough cash value life insurance if you can qualify for it to cover your exit with living benefits, so that, again, it protects all of the assets in the family. So if that sounds interesting to anybody listening here, and as I will always say, if class, you want to really learn in the deeper parts, please give us a call. We are more than happy to go through this with you on a one-on-one basis. Let's take a look at that fee report. Let's dive into the income plan. Let's look at the risk assessment. Let's find the unnecessary losses and learn how to stop those, and then learn how more income can be made from that. Learn how you can apply the tax analysis to your situation. Find out how much taxes you're going to pay, and then find out how you can fix that problem and get out from underneath it with 1/3 of the price. So for those who call in right now, the next 10 of you that call in, take advantage of this opportunity. You'll have priority spots on my calendar. Rebecca and Morgan will get you set up. They'll gather some information from you, and they'll make sure that you get the date and time of your choice. And we just want to make sure that your income will last all of your life, folks, no matter how long it is. Let's use that proven Wealth Defender strategy. Let's build that customized income plan. Let's lay it all out on paper so you can see how that roadmap looks. Give us a call, folks. The next 10 of you right now, no obligation whatsoever, totally complimentary. Give us a call. Jackie, what's that number?
It's 800-719-7917. 800-719-7917. Call the Money Professor. Get on the schedule. No cost, no obligation. If that wasn't made clear, let's say it again. 800-719-7917. And the mailbag coming up next.
Chris Longworth, money professor, no stressor, teaching stacks, you know he the blesser. From 9 to 5 grind to chill all the time, fixed index annuity, the financial climb. Retire early, don't you worry, call Chris. Setting up finances, he never miss. Taxes trimmed, every day is Saturday bliss. Flip them dollars long term, no risk. Money professor, making dreams so real. Never go broke, he show you the deal. Every day feels just like a vacay with Chris Investments made the smart way. Bringing wealth, no stealth, just pure gain. Longworth the name, in lights the same. Stacks on stacks, paper grew insane. Retire early, just let him explain. He got that fix, no tricks, annuity straight. Cut back taxes, ain't no debate. From Wall Street to Maine, know the gains. Chris Longworth, breaking financial chains.
We're dipping into the questions and answers for the Money Professor here. Chris Longworth is about to address things for you. I'm Jackie Selby. And I've got all the 3x5 cards arranged. Submitting questions from the listening audience for you. Are you ready, Chris?
Let's do it.
All right. We have someone living in they're 70, living mostly off of Social Security. They've got RMDs coming up and wondering if a Roth conversion still makes sense at their age to reduce the future tax burden for their children. Is there a point that it's too late to do a Roth conversion for estate planning purposes?
You know, I love this question. This is a common question, and depending upon, I will answer it this way. Depending upon who you ask, you will get different responses. Now, I've gotten multiple different responses from multiple so-called financial professionals, and none of them were correct responses. This is simply a mathematics problem, folks. I'm going to make it real simple for all the listeners listening right now. Conversion is simply a math problem, nothing more. Don't buy into anything else that anyone else says to you. Don't get emotional about it. Just do the math and decide whether if I'll use an example right out of the book. A $700,000 IRA, if you take those RMDs and don't reinvest them, spend the money, take it and spend it, you're going to pay $392,000 in taxes out of that $700,000, more than half the account. 60% of the account will go to taxes in this exchange.
Oh my.
That is a mathematical fact. Now, you can make the whole problem go away for $175,000 at one time. That's $315,000 difference. I don't care who you are. That's enough to get your attention. Mm-hmm. And if anyone says that's not worthy of my, don't, it's not worth it, I would say thank them for their time, get up and walk out quickly. Don't look back, because that person has no knowledge to share with you that is valuable to you in any way if they're going to tell you that giving up an extra $315,000 is okay. I'm sorry, no. I'm going to say, no, that's not okay, man. When you can get rid of the problem for $175,000, and I can show you how you can earn that money back very quickly over time if we have time. Remember, there are no RMDs on a Roth account. You don't have to put it into distribution. Once you convert it, you can literally let it grow back to its full, and that's all tax-free that you get to enjoy. and passing tax-free to your beneficiaries, it most certainly is worth it to convert. And like I said, we do this every day of the week, and I can show you how the math really plays out. So it's a good question. No, it's never too late. And that's the question. No, it's never too late to convert, because the tax burden is never going to go away and it's never going to become smaller. Remember, right now, we're in the smallest, lowest income tax environment of your life is right now. It's not going to get any better, folks, but it most certainly will go higher in the future. Think about that, right?
Yes.
Who in this room right now would raise their hand and say, no, Chris, I think taxes are going to go down? Really? No, taxes are going up. I mean, they are going up. They have been steadily going up. We're just happen to be in a low environment right now because of the current extension of the tax bill, but the next administration may not be so favorable, and Congress is the one that sets all these rates. So it is not a given by any measure. We have no idea what's going to happen at the end of 3 years, but I can certainly look forward and kind of anticipate that I might say taxes will go up in the future. Yes.
Very good information, and thank you for the question. 800-719-7917.
I like that one.
Yeah, get scheduled with Chris Longworth so you can get some strategy worked out for yourself and peace of mind.
So much difference.
Yeah, 800-719-7917. Chris, on that subject, before age 70, isn't there a better strategy than to just wait till that RMD is about to dump on your head?
Absolutely. Time is everything. If we're thinking about it now, right, RMDs don't kick in till 73. So convert now and let the money grow back, so where by the time you get to 73, you might have most of your tax money back in the account, right? If we use a bonus type program, you certainly can have all your tax money back in the account at the end of that time period. It's just compounding growth. It's simple mathematics. So we have to be able to have the time and be using the right product. And certainly conversion is not again, it's probably one of the most misunderstood topics out there. So, I would caution everyone very carefully that if you're interested in conversion, please call us. If you ask maybe the person you're working with or somebody else, they may not be as skilled or knowledgeable. They may give you some bad or erroneous advice, as I've heard so many times, as, no, it's not worth it, don't do it. And it's like, you're never going to convince me mathematically that is the right answer because of the giant difference in the taxable difference. It's just mind-boggling. So,
sure.
Yeah.
Well, get planning, and it all starts with the phone number, 800-719-7917, 800-719-7917. Call
Huge
Chris
difference.
Longworth. Yeah. All right. How about this? Considering moving from a high tax state to somewhere with lower taxes to stretch the retirement income out, but also want to stay near the grandkids. How does somebody weigh these family ties versus the financial advantages of relocating in retirement?
This last week, we're talking to a family that is living here, and a lot of the family has relocated to Texas and Arizona. So their work horizon is another 5 years, and they want to be able to retire and have the flexibility to be able to go to either Texas or Arizona. So they want to, retire, be close to the grandkids, and do the grandma-grandpa thing, which I think is wonderful. And all it takes is advanced planning. We've got 5 years. That's plenty of time to get their stuff organized, so to speak, right? Get their plan organized, get the income piece in order, figure out what they're going to need, make sure that is accommodated. Like I said, we have to really understand what those expectations are, and then we can design a plan that will meet those expectations and exceed them. And that's really where it gets kind of fun. So, having that ability to work with folks and literally make their dreams come true, it's not difficult. It's architecture. It's financial architecture.
And to get your advanced architecture one-on-one, call Chris Longworth, 800-719-7917, 800-719-7917.
Yeah.
We have time for one more here.
We do. Let's get it.
In their mid-60s, noticing that their spending in retirement is actually higher than it was when they were working, thanks to travel and helping out adult children.
Wah, wah, wah.
Yes.
Gee, didn't think of that one, did we, honey?
How do you help retirees just their so-called go-go years to make it?
This, one of the biggest nemesis we talk about in retirement is this piece, not planning income correctly. Getting started, and I always like to say, Jackie, the start is always wonderful. Start to retirement, the first couple 3 years, it's enjoyable. People are literally letting off a ton of pressure, and then the reality check comes in, just like here. Oh, honey, notice that the account's getting kind of low. Well, their quality of life has a dollar amount that cost X, and if you are drawing more than the account's ability to provide, that is called the law of diminishing returns. You are consuming it faster than its ability to grow back. And that is the danger spot that early retirees or not well-planned retirees can find themselves. And this is the 60+ percentile that is happening right now of recent retirees that fell short and are now looking for work. They're back either looking for part-time or full-time work, and they're only 3 to 5 years into the retirement. What does that tell us? More than 60%. I'm going to say it again. More than 60% of current retirees are looking for part-time or full-time work. That's a failure, folks. That's a dismal, abject failure. The system has failed those people.
System. Yeah.
Whoever they're working with has failed those people because it gave them the false impression that they could do something that they financially were not in the position to do.
Wow.
Think about that for a minute, right? Now, again, to the listeners listening, is that you? Are you expecting something to happen and you are totally engaged in that expectation? You believe it. You want it. And you're using financial tools and financial vehicles and instruments that are not capable of delivering what your expectations are. I'm telling you, it's going to be a tough day when that realization comes, and all of a sudden you look and say, "Well, honey, I'm gonna head down and see if I can pick up a part-time job somewhere." I mean, that's not a well-planned retirement, right? That's a poorly planned one. And I always like to joke and say the blue vest retirement plan is really not the plan you want to end up with. But there again, many people do, and it's because they didn't have that forethought to look forward. They didn't take the time to write it down. They didn't take the time to do a little bit of exercise. They did not take the time to learn a couple things and then apply what they learned to their situation. They didn't do that. And this is what they get. And this is, like I said, the larger portion of what we're watching, which is sad. This is what we fight against and fight against hard, is that financial illiteracy. They didn't know because they were illiterate to the facts of what needed to be done. So, folks listening here, I'm gonna do once more. If you are within the sound of my voice and you would like to really get a better understanding, what are your options? What does that really look like? What can you really do? But not just that, how do you feel about it? Do you want to feel better about what you're doing? Then sit down with us. The next 10 that call in right now, you will have priority spot on my calendar. We will take a look at that income report. We just want to make sure that your income will last all of your life, no matter how long that life is. And we can make it last multiple lives if we need to. Let's take a look at that fee report. What is that costing you? If we can help you save some money there, then that's more money for you. The risk assessment. If we can spot those unnecessary losses and fix those, that's more income for you. How about the tax analysis? Do you really know what the tax man's going to take away from you? And I like to say rip away from you. It's dramatic, folks. You really need to understand that, and we can show you how to minimize that. Now, remember, we cannot evade the tax man. That is illegal. Please don't do that. But we can certainly avoid the larger portion by understanding how to pay the discount price and get rid of it sooner than later.
Yeah.
Let's sit down and do the income report. Let's use that wealth defender strategy. Let's build the income stream out so you can actually see what happens and how these programs
Seattle
work.
Red on 770 KTTH Seattle, 97.3 KIRO FM, HD3 Tacoma Seattle, 94.5 K233 DT Eastlake, 33 BU.
Turbulence. I'm Angelo Bavaro, Fox News. Hundreds of U.S. flights have been canceled or delayed today because of the ongoing government shutdown.
More than 1,300 delays and more than 800 cancellations. Charlotte's International Airport, JFK in New York City, and Atlanta's Hartsfield-Jackson International Airport are among those topping FlightAware's misery map. This, by the way, happening with a 4% reduction in flights in 40 airports. Transportation Secretary Sean Duffy says that number could go up if staffing shortages continue.
This shutdown doesn't end relatively soon. The consequence of that is going to be more controllers don't come to work, and then we're going to have to continue to assess the pressure in the airspace and make decisions that may, again, move us from 10% to 15%, maybe to 20%.
Still, a lot of travelers say it is time for Congress to reach a solution.
Fox's Madeline Rivera. Lawmakers are trying again today to cut a deal.
Wheels are turning behind the scenes, but it's unclear if a weekend session can reopen the government. There's a plan to run the government through the end of January. It also funds the Department of Veterans Affairs, ag programs, and Congress until next fall. It needs 60 yeas. Now, Senate Minority Leader Chuck Schumer offered a straight funding bill yesterday, but he tacked on a year-long extension of money for Obamacare. Republicans flatly rejected that. Democrats also blocked for a third time a bill to pay government workers. Democrats believe that bill gave too much power to the president to pick who gets paid. Senate Republicans are hopeful they can get a test vote this weekend on the new temporary spending plan.
Fox's Chad Pergram. Amid the shutdown, the Supreme Court has issued a temporary block on a lower court's order requiring the Trump administration to fully fund the SNAP program. America is listening to Fox News.
The following paid program on this station is pre-recorded.
The following is a paid advertisement brought to you by Purity Products. These statements have not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi there, and welcome to Healthline by the fine folks at Purity Products. One of my favorite guests is on the line. We've got Chris Killam, also known as the Medicine Hunter, standing by now. CNN calls Chris the Indiana Jones of natural medicine because he's, constantly scouring the globe, searching for natural remedies. You may have seen Chris on the Dr. Oz show or maybe on PBS or CBS and also on Fox News where he does a health segment. He's been featured in the New York Times and also on ABC's 2020. Anyway, Chris is joining us today to discuss not one, but 3 of the hottest nutritional ingredients out there on the market today. Even better, he's teamed up with Purity today to give away a complimentary bottle to everyone out there in the listening audience. So do not, I repeat, do not change that dial. But first, a quick introduction. Chris Killam is an author and an educator. He's written 14 books. He's conducted research in over 30 countries. Again, he's been on with Oprah and Friends and Dr. Oz. Chris, welcome back to the show.
Thank you so much. It's always a pleasure to have a great conversation with you.
Now, most of us are super busy these days. We want to stay healthy, but quite frankly, it can be daunting, with all the different supplements out there. Now, Chris, you've traveled all over the world learning about different natural remedies. So you really know which ingredients to look for. So tell me this, besides a good multivitamin and some fish oil, maybe a few other things, go into the 3 super hot nutrients you've been so jazzed about lately.
Well, I'm happy to do that. The 3 super nutrients, as we like to say, are a green tea extract, a turmeric extract called curcumin, and an extract from red wine called resveratrol. And apropos of what you said about my traveling around the world, I've extensively investigated these in their host countries. So I've been in the green tea plantations of China and India and worked with top researchers of this ingredient in those countries. With turmeric, I've been deeply involved with turmeric researchers in India and seen all of that. And with resveratrol, I've worked with scientists in Europe and also in California and Chile and South Africa, all of which are major red wine producing areas. So I've had the opportunity to investigate these things in the field, meet with the top scientists, and my conclusion is that green tea, curcumin from turmeric root, and resveratrol from red wine are remarkable health-enhancing agents that everybody can benefit from in a very, very substantial way.
Now, Chris, let's talk about these big 3. And it's interesting that they're all found in our diet and all are considered superfoods. The green tea, the curcumin, the resveratrol. Why did you want to combine the 3? There's always a method to your your madness, if I can say it that way, because you combine these things together. You call it a real game changer.
Well, when I look at these, there actually isn't a reason to put them all in separate products. They do go very well together. As you said, they're all food derived, so it's kind of like you can make a salad if you choose out of many vegetables. You don't just have to have a bowl of lettuce or a bowl of cucumbers. And while that's a little bit simplistic, the fact is that all of these are very, very rich in groups of protective compounds that are both antioxidant, so they actually protect our organ systems, so they maintain a healthy inflammatory status in the body. And this is really a big breakthrough. I also like the idea that people can get a concentrated supplement of green tea extract, curcumin extract, and resveratrol in one product with truly meaningful amounts of each one, and not have to go out and basically buy a shopping cart full of stuff.
Now, let's dive into the headlines and the research, especially on this green tea, because it's absolutely amazing. I know in Asia they've been using it for thousands of years for healthy aging. But what are you seeing recently in the press? I know you told me the Nutrition Research Journal in its July 2012 issue revealed that green tea significantly increased plasma antioxidant activity and whole blood glutathione. Can you recap some of these headlines and tell me why you're such a green tea advocate?
Okay, what you just said about increasing plasma antioxidant activity is really critical. There are many antioxidants that people consume that don't actually wind up in the body, or they don't wind up in the body in any significant amounts. The green tea antioxidants, which we know are among the most highly beneficial antioxidants in the entire world, are very well absorbed. They improve plasma antioxidant activity. That is the blood concentration of antioxidants. So what happens is you get this great concentration of antioxidant substances, which are protective compounds, floating around in the body and protecting the cells of your body, your organs, every part of your body, from premature destruction due to exposure to environmental pollutants and things in the diet. With regard to the whole blood glutathione, when we take in the right antioxidants, and not all antioxidant compounds are the right antioxidants, our bodies produce more of its own super protective compound called glutathione. So you take in the green tea extract, you build the antioxidant activity in your blood, and you also cause your body to produce this enormously beneficial, very well-studied, very powerful protective substance called glutathione. So it is remarkable. This isn't something that most high antioxidant foods or supplement ingredients do, but it does happen with a concentrated, properly made green tea extract.
All right, let's switch gears and talk about this curcumin, which is number 2 on your list. And by the way, these 3 ingredients are all found in the new green tea combo formula. We're going to be offering a free bottle in a few minutes, but talk to me about the curcumin, which is spelled C-U-R-C-U-M-I-N. Now, most people haven't heard of it, but scientists and researchers know it's one of the most powerful superfoods on the planet. It can positively influence our DNA, maintain joint comfort, healthy inflammation, and more. Can you share some of the incredible headlines on curcumin and tell us why you use this, and we talked about this off air a few minutes ago, this patented curcumin with greater absorption?
Okay. Well, first of all, I think while people might not know the term curcumin, they may well know turmeric root, which is a yellow spice, and it shows up in curries, and it's part of the 5,000-year-old Indian Ayurvedic system of medicine. I've been studying turmeric and its derivative curcumin since the 1970s, and I'll say this right off the bat, that there are almost no plant materials in the world as extensively studied as this. A couple of thousand studies can be found in the scientific and medical literature. We know that curcumin is powerfully antioxidant. We know that it has a remarkable capacity to protect the liver, and the liver is our primary detoxifying organ. It greatly enhances joint health. So if people are experiencing joint discomfort due to overuse, this really helps to relieve that. And it's also what we call cardioprotective. It helps to protect the heart. It helps to maintain normal, healthy cholesterol. And one last thing that is really kind of astounding is that curcumin actually causes your body to produce what are called neuroprotective factors in the brain. So it causes your body to produce these agents in the brain that protect the actual tissue of the nerves and the brain itself. There's almost nothing else that